Good morning, good afternoon to everyone who's joined us today for a stakeholder consultation on improving resilience through inclusive social protection. My name is Tom Spangler, and I'm the Chief of Party for Resilience, or for Research and Learning for Livelihood Security and Resilience at Save the Children US. Before we get started, I'm going to give a review for a few technical instructions for this meeting with you. If you're able, please activate your cameras and remain on mute when you're not speaking. If you'd like to view a live transcript of the presentations, you can click the button at the bottom of your Zoom screen that says CC. You can either view a full transcript, which will appear on the right side of your Zoom screen, or view subtitles, which will appear below the speaker's pictures. You can click this button again anytime to hide the subtitles or transcript. Also note that today's consultation will be recorded, but the recording won't be made publicly available. Finally, if you need any tech support during the meeting, please reach out to anyone with REAL next to their name in the chat box. And if you haven't already, please take just a few seconds to introduce yourself using the chat box. As you likely know, this event has been organized through the Resilience Evaluation Analysis and Learning, or REAL Award. And REAL is a consortium-led effort funded by the USAID Center for Resilience and implemented by Save the Children, Mercy Corps, and Tango International. And REAL's purpose is to respond to the growing demand among a wide range of stakeholders for rigorous and practical support for resilience evaluation, monitoring, and learning. We're hoping to expand on this work by addressing new technical areas within the resilience measurement framework, and social protection has been identified as a specific technical area of interest as it relates to resilience. So today's consultation is focused on improving resilience through inclusive social protection. And this is the second of 3 planned stakeholder consultations aimed at examining connections between social protection and resilience. For today's consultation, we have 2 major objectives: identifying common challenges, promising practices, and lessons learned in the implementation of social protection programming for particularly vulnerable populations. These include informal workers, migrants, refugees, and internally displaced people, women and youth, and people living with disabilities. Our second objective is to identify specific opportunities and knowledge gaps in this area that can inform iteration of policies and programming related to social protection. Your expertise today will help prioritize specific gaps in the area of inclusive social protection that REAL and others might feasibly contribute to filling. We'll start with a brief welcome and presentation of USAID's initial analysis in this area, as well as a conceptual overview from Lara Evans, who is the Social Protection Advisor for the USAID Center for Resilience. We'll then dive a bit deeper into key concepts to be discussed today in introductory remarks from Valerie Smith, who is the Deputy Director of Social Protection in the Department, Deputy Director of the Social Protection Department at the International Labor Organization, and Ruth Graham Golder, who is the Social Protection and Gender Advisor at UNICEF. So with that, I'll pass it to you, Lara.
Great, thank you so much. Actually, I'm going to be brief, and I'm just going to say good morning, good afternoon, good evening from wherever you are joining us. And thank you so much for joining us for this important discussion. We are grateful to each and every one of you for your willingness to share your knowledge and experience to help us identify key barriers and opportunities in to achieve our common goal of making social protection more inclusive and ultimately transformative. I especially want to thank our facilitators and presenters. We have amazing colleagues from ILO, UNICEF, UNHCR, and Save the Children that have graciously agreed to introduce us to this topic, to help drive key questions for us to explore and dig in. As Tom mentioned, this is our second of 3 consultations. Our first consultation was around social protection and climate. This one, as you know, is around social protection and inclusion. And our third one is going to be looking at the role that social protection can play in building social cohesion in fragile and conflict environments. And each of these three areas came up from a broader consultation that USAID conducted last year to just sort of say, like, what's happening in the space? How can USAID engage? What value can we bring to the table? There's so many actors in this space. And these were sort of topics that came up that we thought we could dig into a little bit further, and that the information could be given to each of us then to sort of figure out how we can contribute to removing the obstacles and barriers and making better connections in each of these three areas: climate, inclusion, cohesion. So I'm going to stop there, and I'm going to turn over to Valerie Schmidt, who is the Deputy Director of the Social Protection Department at ILO. And she's going to give us an overview of the importance of inclusive social protection. So Valerie, over to you. Thanks so much.
Thank you, Lara. Thank you, Tom. And I'm joined by my colleague, Christina Behrendt, who is the head of the policy unit in the Social Protection Department, and we will share the presentation together. So next slide, please. Yeah, so let's start by explaining that social protection is, of course, a human right, but it's also a socio-economic necessity. And there are at least 4 reasons why countries really need to invest in their national social protection system and expand social protection for all. So first, the fact that social protection is a human right makes the obligation for states to respect, protect, and fulfill this right to social security for all. Second, investing in social protection, and this is demonstrated by research at the micro, meso, and macro level. Investment in social protection has high socioeconomic returns for the individuals, for the economies, the societies, the enterprises, etc. Third, we saw during COVID, but this is also based on many experiences from different crises, that emergency social protection, for instance, in terms of cash transfers or free access to healthcare, can really help stabilize the socioeconomic situation during a crisis. And it also accelerates the recovery. And it also avoids social unrest, and it's really key to rebuild or to foment the social contract. And I think your discussion on social protection and social cohesion will be very interesting, and I think ILO has also a lot to say on this in this discussion. And last, social protection helps people and enterprises transitioning from, for instance, the informal to the formal economy, also from a polluting environment to a green economy and society, because it helps people and individuals it facilitates their transitions during the life and during also their working lives. So we will see that with the example of the informal economy in particular. Next slide. Despite all these good reasons, social security is not yet a reality for all, or social protection is not a reality for all. We estimate that 4.1 billion people are still excluded from social protection. They have access to nothing, no access to healthcare, no pensions, no unemployment benefits, no sick pay, sickness benefits, etc. Of course, this gap is most pronounced in certain regions of the world, and in particular in Africa. So this is why also this conversation with you is so important, because I understand that USAID has a lot of operations in Africa. So in Africa, on average, less than 1 in 5 persons is covered. And the exclusion, the lack of social protection is more pronounced for certain branches of social protection, such as unemployment protection, which is the least developed area of social protection. And of course, as we will see throughout the workshop, it's more pronounced for certain groups of the society, such as workers in the informal economy, migrant workers, domestic workers, rural workers, etc. And it is key that without social protection, there is no resilience against the individual risks such as health risks, such as unemployment risks, such as the death of a family member. So there is no individual resilience, but there is also no resilience against covariate shocks, such as an epidemic, such as food prices increase, etc. Next slide, and it's for Christina.
Yeah, thanks a lot, Valerie. And in fact, most of those excluded are in the informal economy. So just to kind of maybe focus a bit on that, on what is actually the informal economy. And I think we're going to have a more in-depth discussion afterwards in the breakout rooms on informal workers, but also on other groups which are also primarily found in the informal economy as long as they're part of working age. So what are we talking about? I mean, the informal economy describes those who are not covered by formal arrangements, are not covered by the legal frameworks and not covered by the institutional frameworks that link to it. And when we talk about the concept of the informal economy, it actually comprises both enterprises and employment. So when we want to zoom in on the informal sector, this is an enterprise-based concept. So this is basically about informal economic units. But we know that informal employment, which is a bit of a broader term and which is a concept based on workers, this includes workers both in the informal sector, but we also know that informal employment exists in the formal sector. And social protection coverage is essential really to protect workers and increase their resilience, obviously, but also to facilitate the transitions from the informal to the formal economy. And given that social insurance coverage specifically is often used as one of the indicators for measuring informal employment, also the extension of social security in a way directly contributes to formalization. We all know that the formalization is a much more complex process, but social protection is really one of the key components. And so this is why social protection is so central in that respect. Next slide, please. And when we talk about the extension of coverage, we're talking about both, on the one hand, social insurance, but we also need to talk about non-contributory mechanisms, which in many cases are financed through general taxation, but also through, in many cases, also external support. And these really need to work together within social protection systems, and making sure that there is at least a social protection floor that can guarantee at least a basic level of social protection. And what is also very critical in that context is also that social protection policies don't happen in isolation. So looking at them in a comprehensive way, linked to other policies, for example, employment or macroeconomic policies, other social policies, as is the case, for example, in the context of the Global Accelerator for Jobs and Social Protection for Just Transitions, is especially important in the current context of climate change, multiple crises, and also kind of the demographic change, the structural change of labor market and economies. Next slide, please. And in order really to move forward with that extension, and I don't want to go through all the details because we have a specific breakout group on that, but I think it's important really to identify and address the existing barriers and to ensure the adequate protection, and then also see to what extent this can also facilitate transitions from the informal to the formal economy in the sense of a transformative approach. And for some people, this can happen relatively fast. For others, it will take a long time. For others, they might never be able to move to the formal economy. So, but this is why the protection part is really the important one. So really making sure that everyone has at least this basic level of protection. And with that, I'll hand back to Valerie.
Thank you, Christina. Next slide. So the coverage gaps that we see around the world, so 4.1 billion people who are not covered at all, and among the rest of the population, a number of people don't have access to adequate protection. So these coverage gaps are linked to insufficient investment in social protection. It's not the only reason, of course, as Christina mentioned, there are many barriers, but this is one of the reasons that requires bold action. And we estimate at the ILO that low-income countries alone would need to invest at least $78 billion per year, in addition to what they today invest in their national social protection system, to guarantee what the ILO calls the social protection floor, which is the minimum entitlement that anyone should have. So it's access to healthcare, it's old age pensions, it's family benefits, it's maternity benefits, this kind of basic benefits that everybody should be able to rely on. And for countries, let's go back to Africa, in sub-Saharan Africa, this means that countries should triple their current investments, so multiply by 3 their current investment in social protection to establish these nationally defined social protection floors. Next slide. So achieving universal social protection, including all the workers in the informal economy in existing social protection systems, requires more investments. And there are many avenues to increase the level of investments for social protection, notably at the domestic national level. For instance, by increasing tax revenues, by expanding the coverage and therefore the revenues of the contributory social security systems, by reallocating public expenditure, by ensuring that existing resources for social security are well managed, well spent, so they're working on the effectiveness, the efficiency of social protection systems, eliminating corruption, of course, and illicit financial flows, and also by managing debt through, for instance, restructuring debt. But we also know that for the low-income countries, especially in the current context of the triple crisis, the food, energy, and the COVID-19 crisis, for many fragile countries, it will be very difficult to achieve universal social protection in the next decade without any additional support that can come from the international community, either through more ODA, more financial resources, but also through an environment that is more conducive for these countries to invest more in their social protection systems. So we have a whole series of papers explaining that, and so I will go directly to the next slide. So achieving USP requires more investments, but it also requires better investments. What we mean by better investments is designing the social protection systems in line with a number of international treaties that we call the social security standards, such as the recommendation number 202 on social protection floors, which was adopted 10 years ago, and ensuring that the guiding principles that of this recommendation and other standards are really reflected and implemented through the design of the national social protection system. Why? Because these instruments really give the key for the success of the social protection system, both in terms of its design, its management, its financing, its long-term governance, etc. And for instance, the recommendation 202 provides a number of principles related to the responsibility of the state. The idea, of course, is to ensure that the state is and remains responsible for its national system. So it's very, so it's not the responsibility of the international community to develop parallel systems. This recommendation number 202 highlights the importance of achieving a national consensus, because social protection policies, they are not only the responsibility of governments, they are the responsibility of the whole society, because everybody is contributing to social security, either through the taxes or the social security contributions. So it's important, for instance, that workers' organizations, employers' organizations that represent the private sector participate in the design and the governance of social protection systems. There are also guiding principles related to the inclusiveness of social protection systems, and I'm sure Christina is going to say a word on that. Next slide, and over to you, Christina.
Yes, yeah, thanks a lot. I'll do that very briefly because I realize that we're short on time. Now, in fact, the principles that Valérie has just mentioned are extremely relevant for that discussion, such as universality of protection, non-discrimination, social inclusion, and responsiveness to special needs. And this is really critical for a rights-based approach, which really contributes to the resilience, not only of individuals, but also to societies, and really kind of both at the micro and macro level. And I think in that context, it's important also to design social protection systems in a way that we can really respond to different situations and needs in a way that is adapted. And I mean, we've just highlighted some specific groups here just to illustrate a bit kind of the diversity. And I think when we come to the breakout groups, and we also look at people in the move, we look at women and youth and persons with disabilities. I think we have other contexts that we need to look at. But I think what is important and what is really kind of one of the key messages to retain is really to look at social protection, not just as a kind of a stopgap measure, but really to look at it as part of a transformative approach that can help to realize universal social protection and decent work for all. And with that, I'll hand back to Valérie.
Thanks, Christina. I think we are done with our presentation. We have an additional slide if you want to show it, which includes a number of resources, and that should be shared, I guess, with all participants. Thanks a lot for your attention.
Thank you very much, Valerie and Christina. I think, Ruth, if you could please offer your introductory remarks, that would be helpful.
Absolutely. I hope you can all see me and hear me. Please, alert if not. But I just wanted to acknowledge how much expertise we have in the room, and I'm really looking forward to our breakout discussions. I think my job in terms of the introductory remarks is really just to make sure that we're all on the same page and give a mini deep dive in 10 minutes into some of the specific challenges, gaps and opportunities for specific groups that are marginalized, excluded, discriminated against, and face specific forms of inequality in every context. So I'm going to be really diving into age, gender, disability and migration. Next slide, please. So the first thing I wanted to say, I mean, very much building from what has just been shared around inclusive social protection, UNICEF and the ILO are absolutely aligned in terms of supporting universal social protection systems and working in progressive realization towards universal coverage, but really wanted to unpack a little bit why the life course approach is so critical for inclusive social protection. So looking at this infographic, just to sort of spotlight a few different points, we can see that, let's take pregnancy to the first 1,000 days. In every context, people will need specific support at this point in the life course, both for young children, but also for the families and caregivers, from a range of child grants or benefits through to maternity and parental protection protection and paid leave, and then sort of sweeping around the life course approach, thinking about adolescents and youth, very specific needs, both in terms of supporting skills development and a transition to safe, healthy, productive adulthood and employment. But to kind of pull out some of the strands of what we're talking about in terms of inclusive social protection. Clearly, if you are a girl, if you're a person with disabilities, there are a number of, if you're a child on the move, there are going to be different specific needs and challenges and risks that you face. And so when we talk about universal social protection systems, we really need to be thinking about people as whole individuals with a range of different specific needs and experiences, and also very explicitly to recognise and acknowledge the systems of discrimination, marginalisation that people face. And we see this as an absolutely critical part of the Leave No One Behind agenda. And so for that reason, we're going to dive in a little bit further to gender and to women and the specific discriminations and needs there, to age and especially to children and youth, to disability, and then to sort of refugees and internally displaced people. Next slide, please. So I want to share a bit of a working definition. When we're talking about inclusive social protection, we're looking at universal rights-based systems that provide social protection to every person when it is needed across the life cycle, and not just sort of one form of support at one specific moment, and that we're really responding to those specific risks and needs. And that we're also seeking to explicitly tackle inequalities and empower marginalised groups. And I'm going to talk very briefly about some of the evidence that we have that social protection absolutely can do that, and yet is really designed to do so. And also to highlight, looking at kind of the specific forms of marginalisation and discrimination, inclusive social protection absolutely needs to take into account a whole range of factors which are usually overlapping and experienced, multiple layers for individuals and across the life cycle. So including socioeconomic status, age, disability, ethnicity, perceived race or caste, faith or religion in some contexts, gender, geographic location, HIV/AIDS status, indigenous populations, migrants, IDPs, refugees and asylum seekers, which for some obvious reasons we're grouping together, and LGBTQI identity. So in this consultation, we're focusing on a number of groups, but I wanted to highlight that we need to be thinking about this as a whole, a sort of intersecting set of marginalizations. And so I hope in our breakout groups, we can sort of think a bit about, yes, we're talking about women and youth, but that intersects with a whole range of other identities. Next slide, please. So I wanted to highlight, just for the kind of areas, the groups that we're going to be focusing on, a few of the very specific challenges and why I think they merit the attention and the focus that we're giving them today. I mean, first of all, to say in terms of age, we know that children are twice as likely to live in poverty as adults, and thinking about this sort of across the life course, specifically for young people and adolescents at this point, there are some very specific challenges. And then thinking about this sort of intersection. So, for example, we know that adolescent girls in low-income contexts are now twice as likely to be not in employment, education or training of any form. And so, we talk about the youth dividend, the demographic dividend, but ensuring that that's actually realised requires that strong social protection systems and labour market policies and programmes that support girls and boys. Just to draw out a few of the other sort of facts for us to hold in our minds as we go into the discussion. In terms of gender, we know a crisis of gender inequality before COVID, but in many contexts, we're seeing large numbers of women who have left the labour market during COVID, partly because of such weak social protection and care systems, but in many cases not returning to the labour market. And so a huge challenge in that kind of regression in economic empowerment, but also spiralling rates of violence and child marriage, average time spent on care work, unpaid care work, spiralling for adolescent girls and women. So huge challenges there. In terms of disability, we know that not only is there very poor coverage for persons with disability in the first place, and specific barriers for accessing social protection, but also that specific disability-related costs are not accounted for. And then, I'm just highlighting a few facts to get us going. But in terms of protracted displacement, we know that not only are the number of people who've been forced to flee their homes more than doubling, if we look at sort of the data from the end of 2021 in comparison with a decade ago, but we also know that children are disproportionately affected, and that 74% of refugees are in protracted situations with little sign of durable solutions on the horizon. So I think when we think about social protection systems often excluding them, that is a real challenge. And then, I mean, looking at the data on the slide, just to highlight a few things, we see these very, very stark challenges for children, for women, for persons with disabilities, and for refugees. And yet, when it comes to social protection, only 1 in 4 children are receiving any form of child or family benefit. 55% of all mothers with newborn children have no access to any form of maternity benefit, despite the evidence that we see on infant mortality, women's health, and economic participation. Only a third of persons with disabilities access disability-related social protection, and less than 10% in low-income countries. So really, really staggering. And with the COVID response, we can see that only in 14% of countries were sort of new measures or COVID-related measures inclusive of refugees in the country. And I think that's, it's a microcosm example of how social protection systems at the moment are excluding many refugees and even IDPs because of specific barriers to access when people don't have fixed addresses. So that's a lot of challenge. I'm now going to give just a few sort of snapshots of the kinds of things that certainly at UNICEF we are very intentionally trying to do to address these challenges, just to kind of give us some ideas to work with, and looking forward to hearing from colleagues in the room as well. So first of all, I wanted to give just a few ideas and a sort of snapshot around age and gender. So a bit of an evidence recap of what we know in terms of cash transfers and cash plus. We know that social protection can have a very significant impact on a whole range of outcomes for children, for young people, and for gender equality. So if you can just press spacebar and show a few. So for example, in reducing monetary poverty, we've seen that, for example, universal child benefits or grants could reduce poverty by up to 40% in low and middle income countries. We've seen that they can increase women's decision-making power. So things like not only sort of decision-making in the household around expenditure, but also decisions around contraceptives. We've seen improvement in school enrollment and attendance for girls and boys, improvement in access to health services, including around maternal health, increased consumption and dietary diversity, and then I think when part of a wider system sort of multi-sectoral approach impacts on nutrition. And we've seen reduction in risky sexual behaviours and intimate partner violence. So just as an example, in the Cash Plus programme in Tanzania that UNICEF has been supporting the evaluation of, has shown a reduction not just in sexual violence experienced by adolescent girls, but also an increase in gender equitable attitudes amongst adolescent boys. I think, really interesting seeing those impacts across not just economic, but also social outcomes. And yet 80% of the measures during COVID, social protection measures, were gender blind. So really a mismatch in what social protection could be doing versus how it's being designed and implemented. Next slide, please. Yeah, so just a few sort of key entry points. I'm not going to speak to all of these, but when we're working on social protection policies and strategies, ensuring that they actually look at gender and age-specific risks. So often age and gender blind. We've got great analysis that UNICEF's done together with UN Women on this in terms of gender-based violence, teenage pregnancy, care work, maternity-related economic insecurity. So ensuring that those are really part of the intention and design of the programme. And then in terms of expansion, if you can just click through, because we're a little short on time, ensuring that we're actually supporting that in a very intentional way, whether it's about evidence generation or costing studies. I mean, context is everything, what's going to be most useful. But we see a very strong case for expanding gender responsive child benefits, maternity and parental leave benefits, and childcare. And certainly at UNICEF, we're really pushing to scale up in these areas. And also that social assistance in emergency contexts is, actually considering age. I think the slides are slightly old, apologies, it should say gendered and age specific needs. So often, despite everything we've learned from crisis contexts, these are forgotten. And then finally, I'll just say one thing about this sort of big block of yellow, but is that we really need to think not just about the nuts and bolts of inclusion. It's not just, can the woman or the young person travel to the payment site, or does the feedback mechanism, is the communication around it suitable for people who can't read? You know, it's not just about this very basic, can we get people through the door kind of inclusion. We really should be looking at how are we enabling people to access their full rights, so that social protection can deliver on its sort of transformative potential around economic and social empowerment. Next slide, please. So I just want to say a few quick things about disability. So in terms of some of the key entry points, we think it's absolutely critical to support progressive realization of universal income security and basic adequate standards of living, universal coverage of healthcare costs, including early intervention, rehabilitation and assistive devices, and universal coverage of disability-related costs, including access to gender-responsive community care and support services. We really see that investment in care infrastructure as a critical part of the inclusive social protection agenda. Next slide, please. And then just a few entry points in terms of support to countries with identifying persons with disabilities. So ensuring the disability module in the census, a national disability assessment and development of a registry that's accurate and inclusive. There's big challenges with the exclusion errors. Adapting or shifting away from sort of proxy means tests, which we can see both from a gender, age and disability perspective, often leaving many people behind, and developing additional specific programs that respond to those specific needs for persons with disabilities. And then finally, addressing specific needs. So if you can just click through, thank you very much. Again, I wanted to draw out this sort of trend or thread from the work on gender and age. It's not just about inclusive design and delivery mechanisms, it's about a comprehensive system that responds support. So the sort of cash plus approach, not just the financial security, but assistive devices, rehabilitation support and care services. Next slide, please. We're on the home stretch. So yeah, and then finally, just a mini deep dive on social protection in the context of displacement. We just wanted to highlight, we know we're going to talk more about social cohesion in the next consultation, but that social protection can play a role in prevention in terms of sort of addressing the socioeconomic causes of displacement and migration. In terms of protection, so from supporting displaced populations in crisis to protecting the host population from poverty and vulnerability. I think there's some very interesting studies on how ensuring the sort of mirroring between provision for host populations and displaced populations can really support that. Supporting that transition from humanitarian assistance. I know we have lots of expertise in the room about this, sort of ensuring that social protection systems are shock responsive and linked to humanitarian cash. So that's absolutely critical and a key game changer, I think. And adaptation and integration as well. Next slide, please. Final slide. And then just a few key entry points for action. So I wanted to highlight, along with sort of strengthening the evidence base, how critical it is sort of for understanding political economy and doing some analysis that helps to understand what the entry points will be for expanding social protection, including refugees and IDPs. Program design, as with the other sort of aspects that we dived into, really considering how do we design these programs to be inclusive for people who may not have formal identification, may not be familiar with the local language, etc. Embedding longer term thinking in humanitarian response, so acting quickly and urgently, but thinking about the long term. And I mentioned this already, but this sort of mirroring, aligning the humanitarian response with existing social protection programs and sort of facilitating that system building where you can, and supporting, and I think this is a recommendation across the piece, but supporting the social service workforce and their capacity to make linkages with different sectors, to sort of provide a kind of a cohesive one-stop shop type support for marginalized people who can often find these systems very overwhelming and bureaucratic. So that is it from me. I appreciate it's very hard to do a deep dive of 4 different groups and their needs and opportunities, but I hope I've done an okay job with that, and I'm really looking forward to discussing further with you all.
Thank you, Ruth. Yes, you've done an excellent job, and thanks also to Lara, Valerie, and Christina for the background that you've offered. You covered quite a lot of territory in a short time, but you've set the stage very well for the next phase of the consultation, which will be a breakout room discussion.
And nice to see everyone else here. And I think we have a great group of people with lots of knowledge and experience to share. And we have a very ambitious program. to do so. I mean, we have just a couple of minutes to do 3 important things. So first, the first couple of minutes we'll spend on the question of what do we already know, and just kind of bring out some of the key points about what is already known. Before we move over to the second section, which is about where we have about 20 minutes. And our task here is to focus or identify kind of learning opportunities in 3 different categories. On the one hand, advocacy opportunities, capacity strengthening needs, and research and learning needs. And the last step will be to agree on 2 priorities areas within each of these 3 categories. And I think given that we're already a bit behind our schedule, I think let us maybe jump into the first section and just collect some of really the key issues and the key points of what we already know before we move on to the next session about the gaps and opportunities to make social protection more inclusive. And so I would really like to open the floor for anyone who wants to come in and share their experience about what we already know. So please, colleagues, if you want to come in, and I think we should, given that we're already a bit behind schedule, I think we should not spend more than 10 minutes on that. Ideally, even less than that. So I see that Patience has raised her hand. Would you like to come in, Patience? And then KL Rowe would be the next one. And or otherwise, just jump in. I think I don't need to give the floor. We're a small group. But maybe I see Patience, KL Rowe, and then Laura Alves.
Thank you so much, Christine, and thank you, everyone, and good afternoon or good morning. Good to see you as well. Yeah, I'm just going to add maybe 3 points or so, and then I can leave it there for the team also to just contribute. I think one thing that has been from experience that has really come out clearly with regards to extending to the informal economy is the fact that there are diverse groups, I think, within the informal economy, and which tells us when we are looking at coming up with different mechanisms and strategies, that becomes a very important starting point and an insight to begin from in designing those different strategies. And another issue that we really pick and we have come to realize is the fact that awareness creation is very, very important, because it's just from the onset, there's this, for lack of a better word, lack of trust in social security benefits. The fact that, especially for the long term, the institutions really have to bring the message closer to the people, and awareness with the view that the information and tools, messages that are created should really be broken down for the target group to have a clear understanding. Also, just to add, I think innovation in terms of delivery of service to this particular target group has really been important and critical. But also one of the challenges that we have come to realize in the piloting of some of the schemes, especially in Zambia, that there is this gap in terms of maintaining the contribution density. It's one thing to sensitize them, to put them into the system, especially in the national system, but it also takes an extra effort to have them continue contributing to the fund, for them to retain and build their contributions, for them to be able to access that income security. So those are some of the things that I think have come out very, very clearly, and also that we really need to take into account. Maybe let me just end there with those 3 submissions. Thank you.
Thanks a lot, Patience. I think these are really kind of critical critical points, and thanks a lot for highlighting that. And with that, I'll hand over to Kay and Rao, and afterwards Laura Athas.
Yeah, I thank you for this, and greetings to everybody. So I come from the most industrialized and forward states, Kerala and Tamil Nadu in India, where we are doing a huge study on migrant labor, migrant population, around 25,000 families, which translates to around 55,000 individuals. So one of the important aspect of the informal economy, we are looking at the dimension of the migrant labor and their access to social protection schemes. As it was mentioned, the second point, same thing, lack of awareness about the schemes. Whatever is available, lack of awareness of, for example, the social benefit schemes such as insurance, medical insurance, or another aspect is universal access to education. That's a huge challenge. Education is a right in India. But still, the migrant children are not allowed to be admitted into government-run schools. So that's another aspect. And this is one. Second, very interesting aspect is if we try to compare the age group of, there are around 20 reasons that we looked at why they are migrating. And also we looked at the age profile of the people. It peaks at around 29 years, which means essentially the migrating population, as they migrate, as we compare to the percentage of population in a particular area, it peaks at 29, which means around 24 to 29 is the highest kind of population group in any area as migrant population. These are the ones who are transiting. They start off when they come as a migrants around 18 years of age. They start off as informal sector, as in any kind of industry. They start off as working as cleaning of utensils in the kitchens, and over a period of 7 to 8 years they get some technical education and move to formal sector. But that's an interesting transition that is happening, and this is happening without any support of the government. So you can imagine, if we can trigger the support of the government for 7 to 8 years, they are in a very low paid jobs, unorganized, and on their own they are moving to organize. So I think that is where we are trying to design some social protection schemes so that employment opportunities can be created. And finally, the last point is what happens to the portability in terms of, we don't have a kind of a social protection identity number as such in India. But when they move from one place to another, how do you ensure there is a portability of identity? Therefore, they can have access to social sector schemes. Thank you very much. I'll stop there.
Thank you so much. And Laura, would you like to come in here, or then for the next point when we move over to the next one? It's really up to you.
I'll make it quickly now. It's just quick,
okay.
and I think it's a question of financing, that we know that schemes that rely on informal workers to finance their own social protection are going to have a limited reach. Obviously, there's differences within the informal economy. But it needs to be taken into account that we've seen that these schemes, unless there's some innovative financing mechanisms that are drawn on. So I just wanted to make that point. Could go into the next one.
Yeah, thanks a lot. That's an important point, because especially when you have these kind of small scale schemes which are very kind of homogeneous in terms of their membership, and if there's no kind of also support from the government coming in. I see that Shia, David, and Andre have raised their hands, but given that we have already received the message that we should move to the next point, if you bear with me, can I just kind of very quickly explain again what our task is here, and then I trust you all that you can convert your points for the first section also to the second one, because this is really what we should be identifying here. So the big question here, and then this is the question on which we need to report then also afterwards, is really to identify the gaps on the one hand, but maybe more importantly, the opportunities to make social protection more inclusive. And I think we have three kind of main categories here. On the one hand, advocacy opportunities, and I think we have already heard about the importance of advocacy in that realization, to really linked to the important question of trust, but also in many ways simply also the access to information which is lacking. Then the second category is really to see capacity strengthening needs, and I think we can take that in quite a broad way also to see whose capacities need to be strengthened, and also maybe thinking even about also the institutional capacities, not just about the capacities of individuals, but also capacities of institutions. And the third question is on research and learning needs. So what I would suggest now is maybe kind of collect a few points under each of those categories. And then afterwards, we'll take another step to prioritize and see what are the top two items under each of these categories. And I think with that, I'll hand over. I don't remember who had raised their hands first. So it was Shea, Andre, and David. So maybe start with Shea.
I'll make a go of it anyway. Thanks, Christina. Yeah, I mean, I was thinking more in the framework of the first question, but I'll try, as you say, to convert. And a lot of the basic points have already been made in terms of sort of the situation analysis, I guess, of people in the informal economy. Incomes are low, so there are limits there to how far you can get with contributory schemes. I very much agree with that, but also that people's situations across their working life are dynamic. And so you need to, I guess the implication of that is that the scheme moving in and out of contributory coverage, higher levels that are granted through contributory systems versus the basic protections outside of them, that has to be seamless. And that goes to maybe one of the questions or points about contribution density. And I guess for me, coming at it from the policy side, I don't know whether this might go in research and learning as well, but there's quite a lot that we do know about sort of the ineffectiveness of savings or individual accounts-based solutions for people in the informal sector for those same reasons, right? For the same reasons of low contributory capacity, but also just kind of functional challenges with those models in general, regardless of people's income levels. So that's something where research could really be distilled and really strong statements can be made. And sticking with the research, same thing about voluntary schemes. So you might want to, I think there are lots of questions around the effectiveness and the limits of voluntary schemes. So again, distill that research so that it says very clearly what the evidence shows us on those. And I'll follow the same lines, subsidies to people in the informal economy. Those are very expensive. And there are real questions about whether those resources might be more effectively channeled toward sort of tax financed, life cycle based schemes. We've sort of got the solutions in front of us. It's just they're not being taken up as fast as people would like. But that's, I guess, my main contribution. I don't know where the other ones will go, so I'll leave the floor to other people now.
Thanks a lot. And I think that's just kind of on your last point. I think this is really essential because, I mean, also we need to think people in household context and family context. And I think as important also as those benefits are kind of aimed at a kind of a working age population. But I mean, thinking about the household context and also thinking about the potential, for example, about kind of universal pensions, for example, or kind of broad-based or even universal child benefits. I think that's also an important part of policies that can help informal workers, although they're not directly related or paid to them. So I think thinking about this broader context is important, and so I think that's a key point. And so I think I had David and Andre. David, I don't see your hand anymore, but I see Andre. So would you like to come in?
Yeah, I'm sorry, I can come in now. Yeah, so building on what Shay has mentioned about the effectiveness of these contributory schemes in places where incomes are so low, people are barely surviving, you know, we could have an opportunity to strengthen awareness and understanding of how universal programs are more effective at reaching people in low income settings. Because I think predominantly, especially in the global south, a lot of social protection discussions over the past decade have focused on cash transfers, targeted cash transfers, and very little on universal programs that have greater potential, greater reach, as well as political support. So we could invest in strengthening the capacity of policymakers in this part of the world to appreciate the role of the traditional universal social security systems that are actually responsible for poverty reduction in the global north. So I think that's one specific area we could invest. Over.
Yeah, thanks a lot. I think this is an important point, and really, I just want to acknowledge the great work that Laura is doing in really capturing everyone's inputs. And I see that there's also inputs coming into the chat from KL and also Lara. I think this is very useful, and so Laura, let us know if we should go on a bit kind of more slowly. But I think we can take another look before we move to the next session. But I want to give the floor now to Andre, who's been waiting for a very long time, and so to give his inputs.
Thank you, and I'm sorry my light is really bad, but it's evening here in Vietnam, and I didn't think about my lighting situation properly before we started the call and the sun went down. And I'm sorry, Laura, because I tend to speak very fast. It's not going to be good for you.
I'll do my best.
Let me pick on a couple of issues. I think one has to do with actually one of my pet peeves with the work of social protection, which is our insufficient research on the economic impact of social protection. Because we're talking about figuring out what works, what doesn't work. But even if we figure out what works, then we need to go to the ministers of finance, to the prime minister's offices, and actually convince them, because none of these options is free in the most cases. So increasing our research on about our investment in social protection, regardless of its forms, and also looking at different forms, how this can impact economic activity, can help us make a much bigger case for greater investment in social protection, which we know is paramount importance for us to be able to actually push the agenda forward. And I think on the same token, the capacity, in terms of capacity, we need to increase the capacity of our stakeholders on these issues. Because when I bring these things to the table at country level, it's like I just invented the wheel. These are things that in a lot of cases they have not thought about. It's not that they don't understand it, it's that it never crossed their mind. So the advocacy and capacity strengthening opportunities are there. We need to do more research. We're starting to do some in the ILO. I've been sharing some preliminary results in Vietnam and getting really good feedback from stakeholders. And I think this is a key area that there is a significant gap. And that now we have better data, we have more data, so we can do more than we could in the past. And we need to explore that. And the second point I wanted to make, I wanted to make it earlier on, but then we moved to this area, but it still applies significantly, which is what we know is the multidimensionality of the problem of informality. We're not going to solve it through from the social protection angle alone. And I think this is where we need to create more advocacy, build more capacity, and convince our stakeholders to work together. Because I was having a conversation in ministry last week about this, and we're trying to push them to choose different groups, because as everyone has said, there's very heterogeneous groups, going back to Patient's first point. But we're talking, for instance, about trying to look at Grab drivers, like remote, Uber drivers and so on, and see if we could look at those specific group of workers. And if we could use this trick of making them have to register to Social Security to get the license, which some countries have done. And they were immediately telling us, oh, but the Ministry of Transport is not going to like this because this will make the process more complicated. So this multidimensionality of the problem requires a multi kind of stakeholder approach to it, because ministries or institutions that are in charge of social protection by themselves are not going to be really able to push this forward alone in many cases, in particular in certain groups. So doing more advocacy and explaining how is it important for stakeholders to work together and how this can increase the effectiveness of expanding the support to informal workers, I think it's another really key area of work that we should take into account when we look at expanding protection for informal workers. And let me stop there because I know we're running late. Thank you very much.
Yeah, thanks a lot. I think these were very, very important points, and really thanks for highlighting that, and also thanks for indicating already where they could go in the categories, and also thanks to those who are sharing bits and pieces of text. And I think we can make it easier for Laura if we can formulate it in a way that she can simply cut and paste into the sheet. But for that, before I hand back to some of the others who've raised their hands, I would give the floor to Lara, who hasn't spoken before. So Lara, if you want to come in.
Yeah, thanks so much. I actually just wanted to follow up a little bit on some of the points that Andre made, which is to say, and as I'm participating in this, I'm realizing so many groups that I did not invite to this that should have been at the table. But anyway, the Partnership for Economic Inclusion, which is, formerly CGAP's work under the World Bank, has done extensive work on this costing issue and being able to really succinctly share with ministries of finance, why this is an economic investment and why it is this win-win situation. So just to say that there is data and research out there that needs to be strengthened, but it does exist, and that's a group that's doing it. And just also to share, USAID for a couple of years now has sort of been struggling with this idea of how do you measure the cost of not losing your livelihood, right? So if resilience is effective and all of these preventative measures are working, what's the economic savings that you didn't lose, which is tricky, but it's compelling, right? I mean, I know there are cost benefit analysis that say, $1 up front, $3 later, $1 up front, $7 later. But it is compelling to be able to tell that story and also from a human perspective, right? Like I didn't lose my livelihood because I had insurance, because I had social protection, because I was able to pre-plan for a disaster and had, a plan in place, et cetera. So I just wanted to put that on the table. And I love this idea of multidimensional causes needing multidimensional solutions. And I think there's a lot of really interesting work. And every time I say this, somebody from WFP says that I said it, and then the WFP Caribbean office reaches out to me. But the WFP Caribbean office is really, I think the Caribbean region as a whole is doing a really good job of connecting ministries of social welfare, social assistance, whatever their names are, with disaster risk management, with civil society, with social workers, and sort of saying like, this is a role for everyone. It's not just, the ambulance that comes in right after the storm, but what are all these pieces? And so I think that's wonderful to have both in research and learning and in advocacy, right? How do we do a better job at having a collective vision and understanding how these pieces fit together? And I'll stop there. Thank you.
Yes, indeed. No, I think these were kind of really excellent point. And I think especially, what you said about, in a way, highlighting what is the value of being protected. And I think the value of both for individuals and for families, but I think we can take it even further also to see what is the value And I think we have seen that very clearly also during the COVID crisis. And it's quite interesting. I mean, from our perspective, the ILO works also quite a lot with employers. And there have been, I mean, a much more kind of strengthened demand for social protection, because employers actually realize how much social protection actually helped them in their resilience. And I mean, especially in countries where you have these kind of short-term work schemes, they really helped companies to maintain and retain their workers. And it has a huge effect on productivity as well. So, and then also at the macro level for the economy as a whole. And I think we can work on it and on various levels, and looking and maybe collecting what we already know at all these levels in terms of what is actually the value of social protection at all these levels. I think this is really critical and key. Now I see that we've already kind of keep getting messages that ask us to speed up. So maybe if I may already kind of move towards the last part of our session, and maybe I would ask those who have raised their hands, maybe also to convert what they wanted to say for the last section, because what we have been asked to do is actually to identify the kind of the 2 top items for every one of those columns on advocacy, opportunities, capacity strengthening needs, and research and learning needs. So I would like to, I mean, with apologies to everyone who still wanted to add to the list, but I think if we can move to identifying what are the key points, and I think Laura has done a wonderful job in putting everything together. But I think now collectively we would need to identify what are our top parts, and maybe if we can start on the 2 top items on advocacy. I think we have already a lot, but if I could invite anyone to come in to maybe give us, and I must say, Laura, to try to increase the size a bit more. I think then it would be easier. Yes, I think that's perfect. I think so we can read it a bit better. So if anyone would like to come in already on the question of what are the 2 top items that we have identified together. Now, I don't know if any of those, I mean, share, or any of those who've raised their hands before or wanted to come in. So please feel free to step in.
They're all important. This is very challenging.
Absolutely. Absolutely. I see Kay as well. You've raised your hands. Can you help us in identifying the 2 top items?
Yeah, I would say, you know, given the kind of fiscal constraint that is always there, and with COVID, it's become more accentuated. One big thing for social policy that we need to look at is what is called convergent planning. I think that's the top of the list. Like the way we are doing in the states where I'm working is we have come out with what is called a child policy, and we are using to channelize around 200 schemes into how do we better kind of rationalize and have more impact. So I think it's key for social policy to have social protection, to have those kind of convergent programming. And second is to have that interoperable identity, you know, social protection identity. These 2 for me, you know, look the most important one. Thank you.
Thank you so much. Patience, would you like to come in?
Yes, Christine, I was reading, I think, I'm trying to read it again. There is a point that I saw, I think, which speaks about the need for advocacy for universal social protection, also merged with the point around the fact that informal economy, especially in economies like Africa, where they form the majority of the people in the labor force, they actually play a critical role in contributing to economic development at national level. Yeah. So covering them is really a must, and because they're contributing to national development. Thanks.
Yes, absolutely. I think that that is really a key point, and I think Lara has highlighted the point about advocacy for universal social protection also in the chat, and I think also if we think about really the way of making social protection systems on the one hand equitable, more inclusive, but also more sustainable, I think we really need to think about really including everyone. But I think not only on the benefit side, but I think we also need to think about the financing side. And I think in that respect, it is also important to make that advocacy also with the ministries of finance to really make sure that there are ways of really also for well, basically, I mean, looking at expanding the fiscal space that is there, both looking at the resources that are already there, but I think especially when we talk about low-income countries, this will not be sufficient really. So I think there is also a question about on the one hand, thinking about what can be the external support that could help those countries, but also in the longer run, also increasing the tax base, making sure that there is more tax justice, both at the national level, but also at the international level. And I think that's also an important point that comes in as part of that argument. So I think it's all really kind of interlinked, and so I think that's really kind of a two key points that we could highlight there. So I think looking also at the multidimensionality, I think it's all comes together in that way, and also linking to the point that has been made by Pierre Rao with regard to the looking at the identity, and we're looking at the kind of civil registries, etc., the portability, also to see to make sure that also the systems work well at the national level, so that there's not this fragmentation that we always often see in many countries. So I hope that this with that we already have more or less 2 points for the first one. I think we might be able to go back then afterwards when we have looked at the other dimensions. So I don't know, would you like to come in on this point, or already on the next one on the capacity?
Already, it was actually a dovetail right into the capacity strengthening column. So
perfect.
Yeah, building on that, I think it fits quite well. But building on this idea of streamlining the institutional and governance frameworks across the sector, and I guess I would want to be more specific here, and maybe think about leveraging existing social protection infrastructure as much as possible and not bypassing it. So strengthening those agencies that are already doing a good job of delivering specifically life cycle based schemes, and that includes contributory institutions with all of their disadvantages, but recognizing the advantages that they have, right, in terms of national reach, strong MIS capacity, financial management capacity, relative sort of insulation from some of these other budgetary tussles that we've been talking about. So just leveraging that as much as possible as a way of streamlining rather than going around or creating something new with every new scheme. So yeah, I think I see that as one of the top priorities, even though it wasn't in our initial list.
Yeah, thanks. I think that's a good way, and maybe that could also even be linked also with a point on the kind of the question of identity. I mean, making sure that there is a kind of a coherent also administrative system. So maybe these two could be linked in terms of strengthening the institutional capacities in that respect. So thanks. No, I think that's an excellent point. Patient, would you like to come in on that one?
Yes, actually, I want to leverage on point, I think point number 4, where we are talking about and propose it, but also propose an addition where we are talking about assisting countries to build contribution collection and compliance systems that align with the context and the revenue levels of the workers in the informal economy, yes, but also added with the building the capacity of representative associations or institutions within the informal economy. Because I see that even with our social partners, from the ILO perspective, I think that's where they really have a gap in terms of trying to bring on board representation from associations, organizations that are in the informal economy. They are not effectively represented. So that particular point, but together with capacitating representative institutions from the informal economy. Yeah, thank you.
Yeah, I think that's an important point to really also strengthen the voice and really kind of based on an approach that can really help to empower those workers who are currently in the informal economy. And I think maybe that point also, because I think at the moment it focuses quite strongly on contributory schemes. But I think it would be good also to highlight more strongly the kind of the links with non-contributory schemes. I mean, those who are financed by taxes. And I think one important point here is also, and I mean, we touched upon previously to see with regard to the question of, and I think there are quite interesting examples in some countries which combine the contributory models, but then provide subsidies to workers with low incomes to really make sure that the systems become inclusive, so that they really kind of can come into the system and then gradually also improve their capacities, and maybe also gradually move into a position where they can contribute a bit more. And I think in that context, I think one additional consideration is also making sure, because I think when we talk about vulnerable categories of workers, I think we also need to take into account that sometimes there are also even of those who might be in the formal sector, there are also vulnerable categories. So it's important to link these the subsidies or the support, to not link it to the fact if someone is informal or not, but link it to really their vulnerability, in order also not to trap people in this kind of status of being informal, but really help them to gradually move towards the formal economy. So really as part of a kind of transformative approach. And I think that might also be one point that could be mentioned there. Just looking at if anyone would like to come in on that. I mean, Laura, you had raised your hand before. Would you like to add anything on that particular point on capacity strengthening needs?
Me? Are you talking to me?
Yeah, sorry, we have two Lauras and one Laura. So.
No, yeah. I didn't really have much more to add. I think I really agree with the point about leveraging existing social protection infrastructure as a way of streamlining. I would certainly see that as a real priority. Also, I think not to forget that there are also outside of the state actors whose capacity needs strengthening around social protection as well. So you know, we talk about informal workers participating, but who's making sure that they actually can participate meaningfully in these processes? I think there's quite a big gap still in the work being done around that. So I would add that, but I see, you know, it depends on whose priorities you're looking at.
Yes, yeah, absolutely. No, I think, and that kind of the recognition and the facilitation then also of those processes to ensure the meaningful participation in those processes is really important. So because otherwise there cannot be really kind of a meaningful social dialogue and a meaningful participation in, on the one hand, I mean, formulating the policies, but also looking at how you monitor policies. And so I think that's also important, because I think in many ways, I mean, there is a kind of a learning process, and you need to have these kind of feedback mechanisms that make sure that even though you have a policy in place, I mean, there's always something to improve. So, and what are the kind of the feedback mechanisms that help to ensure that? And I think with that there, I mean, the voice of informal workers is absolutely essential in that respect. So thanks a lot. Yes, so I just see that Laura has asked in the chat to summarize the last point for capacity strengthening. That's actually quite a challenge. Let me try, but maybe we want to go first to the last point before trying to do it. I was trying to integrate that into the one point which has already been identified, but I think that might be kind of overloading it a bit too more. But given that we have only 5 minutes, maybe we should go to the final point on research and learning needs, where we have a very, very long list of things. And so I don't know, Lara, would you like to do a first cut and try to identify the one or two key aspects in that respect?
I think firstly, I would say to the summary point of the last thing is kind of merging number 6 and number 7, Laura, that those fit together. So when you're talking about under capacity strengthening to get down to 2, I think it's merging 6 and 7, right? So it's leveraging existing systems and streamlining them, but that it is also their interoperability, their portability. So I think that's like that the systems function well and take advantage of what's already there. So that's how I would just summarize that point. And then for research and learning, I'm just thinking, I think the words research and learning are a bit limiting in the sense that, what do we want to get out of it? And I was just thinking, I talk with Real all the time about, well, what's the work that we can do? Because we're not going to do like big, huge research, but, like a talking point sheet for how to interact with the Ministry of Finance. Like what are those bullets that you walk into the Ministry of Finance and say, this is what you need in order to be convincing. So I would put that under research and like a field, a field tool that really says like, how can you be compelling, so that you feel emboldened to go in there and make your point. That's what I would put there.
Yes, yeah, absolutely. I think that's a key point. And maybe if I may add also, I think what is also essential in that respect is also this dialogue with the international financial institutions, because I think they also play a key role. And I mean, in the ILO, we are doing that, but I think this is something that might be more kind of amplified more, so that to make sure that this is also part of their discussions on programming. I think that might be kind of just adding to the same point that you made. And,
and that things are not binary, right? That they can exist together. So social protection, and I think we just think of like, okay, where are we going to take money in order to fund this? Or the Ministry of Finance is thinking, what am I taking from in order to do this? But to see, I mean, we know this, right? But it's to see investing in education as a form of social protection, to see investing in healthcare as a form, but how is that sewn together in a package that's meaningful for someone? So that we're not just thinking about, we have to get new money for this new thing, but how does this thing connect things that we're already investing in? And how can we do that in a more impactful way? Oh boy, getting kicked out.
Oh gosh, 5 seconds. Thank you, everyone. See you in the big room.
Do right now is figure out with the country office, what does routine social protection in a context of displacement look like? Not just context of displacement, but also, you know, active conflict look like, and how can we ensure that we're able to follow, not we, but the government is able to follow and continue on with those sorts of social protection measures. I will stop there to give anybody else a chance. Is there anybody that I can hand over to? I'm looking at your mics. Also, MT, if you can just introduce yourself, because we don't even have a name. We just have some initials. And I have recently been Zoom bombed quite a bit. So it's nice to know who everybody in the room is.
Yeah, Zara, it's Matt
yes.
from UNICEF Social Policy.
Hello, yes.
Addis Ababa. Yeah, I'm sorry, I just saw that it's my initials instead of full name. Sorry, I've used Zoom in a long
brilliant.
time.
And Matt,
yep.
We were just hanging out in Ethiopia. I was there last week, and actually you have quite a bit to say about IDPs and social protection and how we've been looking at that.
Yeah, no, it's well, I guess while my mic is open, yeah, I just think just from the context of Ethiopia, when you have a situation where, you know, IDPs and refugees have not traditionally been included in any of the social protection systems. But with the current situation in the country, through conflict and drought, you know, through a lot of advocacy and kind of collaboration between various partners, we've started to see the government approaching IDPs for the first time, using government systems to reach out to IDP populations. So I think it's a good example in Ethiopia of how you can start to you kind of incrementally move the policy dialogue along to start to include IDPs into programming that has traditionally not wanted to deal with the complexity of conflict and displaced populations. And Ethiopia has also started to put refugees into one of the urban safety net programs, the first time it has done this. So we're starting to see, you know, a little bit more traction when it comes to refugees and IDPs, but it has been a big struggle to see them as legitimate beneficiaries or clients within these programs. But I'll stop there for a second, but that's a lot of work we're doing there at the moment is including these particularly IDP populations into existing government systems for cash transfers. Yeah, I'll stop there for a second. Right.
Okay, thank you very much, Matt. I want to encourage others who might be able to provide some updates or kind of new insights on efforts currently being made to include displaced populations into social protection. Any others?
Yeah, I would just jump in and say that certainly in some cases, moving across borders makes things more difficult. In some cases, maybe not. Sarah, it was great to hear about the work with pensions moving with people across district borders, because certainly moving within your own country, when those benefits are really tied to your location, can be a hindrance. And in some cases, rarely, right, in cross-border movement, there are real efforts to reach people with social protection. For example, in Colombia with Venezuelan migrants, there's a really good effort to integrate migrants into healthcare systems. And I know there's similar work in Vietnam and Thailand to integrate migrants into, you know, cross-border migrants into healthcare systems. So I think there are some of those examples for cross-border migrants being integrated into social protection. And certainly some of those barriers to accessing social protection, even for migration within countries, still exist. So I think that's something we want to be aware of. And that's why I was pinging Zara in the chat about some of the work that Ruth mentioned in her talk about mirroring social protection between migrant and host communities. So I'm looking forward to catching up with that.
Okay, thank you very much. Now I know that we have, many people have experience and expertise in this field. I want to kind of put a couple on the spot. I'm looking in particular for you, Tanya and Christina, given your experience here, maybe to weigh in on this topic. Tanya, can you share your experience at the field level with this? Yes, thank you.
Yeah, hi, hello. Can you listen to me? Can you hear me?
Yes, we
Can
can.
you hear me? Okay, hi, thank you. Tanya here from Colombia. I just was also raising my hand. Maybe I would like to provide some insight into particular kind of population that we have here in Colombia, where I have mainly my experience. So I will say that regarding migrants, for example, in addition to having this kind of traditional that we know difference between the legal status, who are regular and who are not regular, and those who are regular, definitely they can access social protection, or they have more possibilities to access social protection. And but even if you have a regular status and you kind of have the possibility to access, it's not guaranteed, because in any case you have to adapt the whole system in order to receive the migrants. So I think that is key. That is key, and as one of the colleagues said before, in Colombia we have like a great good experience of the government opening up the system, not just the health system, but in general the whole of the system, because it did a massive regularization, and it has taken several steps. It is not enough, because also you have to adapt the whole infrastructure of the system. This means information system, for example. You can have the permit, but it doesn't mean that the permit is already included within the information system, for example, of large cash programs or other kind of social assistance of social programs. So I think that is key. That is a key part, because everything can just fall because these kind of operational challenges that are huge in any case. And that will be my first input regarding this topic. And the other one regarding IDPs, that is another kind of situation, of course, that we have here in Colombia. I think that is a situation because the response for IDPs is kind of different. It's a different response. You have to, in Colombia, for example, we have a big kind of institutional response to IDPs. But here comes the debate. So when the response to IDPs can get kind of into a conflict with the traditional social protection, how could you maintain both at the same time? How one doesn't exclude the other one? But these kind of situations occur because the response is large, because it's social, because it's costly, and because also people start making decisions about which one is more beneficial to me. It's better if I keep being like a victim and receiving the response and the assistance from the government as a victim, or it's better if I leave that and I keep receiving the assistance from the social protection system. So I think these kind of situations, maybe it's just my insight to this first question. Thank you. Over.
Thank you very much, Tanya. And I'll again put you on the spot, Marie Christina. Do you have anything to add from your experience?
Sure. I actually raised my hand earlier with a question, and I think Tanya kind of touched upon that as well. We didn't have migrants or migrant workers in the list up there of different displaced populations. And so, I mean, I usually, maybe for those of you who don't know me, I usually work on social protection and climate change. And so obviously in the context of climate change, it's really difficult to make the distinction between refugees and migrants, because there are, by definition, no climate refugees, but there is obviously forced displacement, given the current, both sudden and slow onset disasters that we face in the world. And so I think increasingly we need to figure out how to actually deal with displacement, forced displacement also in that context, that essentially from a legal status considers people as migrants or migrant workers in other jurisdictions, which obviously makes it very difficult to integrate people. If we already have the discussion around integration of refugees in social protection systems, then that obviously makes it even more contentious when it comes to certain groups of migrants. And so there are quite a few interesting examples already. So, I mean, Zara knows this, I used to work in the Caribbean, and so there's a bit of integration already between the different member states of the Organization of Eastern Caribbean States, where there's essentially a human mobility mechanism that allows people from all the different islands to move around and to take jobs in other parts of the Caribbean. So all the different member states, and technically, theoretically, on paper, also have access to social protection benefits. So that's quite an interesting mechanism, especially when you consider that some of the other islands that are not part of this organization, so for example, looking at Turks and Caicos that basically consider, you know, non-islanders as not part of their different systems, is quite an interesting mechanism that we can look at and learn from. I think beyond that, it's just increasingly difficult when people move because of climate-related shocks or longer-term stresses, because most governments still don't consider that a valid reason for people to move, right? And so I think there are some interesting lessons also coming from the Pacific Islands, where you see kind of seasonal migration already happening to Australia and New Zealand, some increasing kind of formalization of those mechanisms, but it usually assumes that people go back. And so what happens when, you know, especially these disaster prone areas or those prone to flooding and more permanent flooding as well, will no longer be habitable spaces. And so I think that's just something I would like to see included here, because it's going to be an increasing problem. Thanks.
Great, thank you very much. And Christy, I see you've had your hand raised for some time. Please weigh in.
Thanks so much, and yeah, great to see this group on here. Just, I guess, when I'm looking at the initial question there, I think we've touched on quite a few, how does inclusion play out differently for displaced as opposed to other population groups, and we've touched on the obvious one is the legal frameworks, which Zara raised as the very first point, and then we've also touched on the fact that even if legally IDPs or refugees have access, there's lots of operational barriers they face. And when I think of those operational barriers, actually a lot of them are common to other groups that were mentioned in this consultation, right? The people with disabilities and women and children and youth, and some of the operational barriers are common there. Some are different. Maybe documentation in some cases might be different, although access to ID is of course an issue for many non-displaced citizens as well. So then if you've got the legal barriers, got operational barriers, then it's like, what is additional beyond that we need to really consider for displaced populations as opposed to the other breakout groups? And I think there it's the fact that you get displaced populations when you have a crisis. So it might not necessarily be conflict or violence, although I think in a lot of the cases we are thinking of that as a very common one. But even if it's just a natural hazard induced displacement, you have got some kind of a crisis. So I think the actors involved, the fact that you would then have the humanitarian sphere involved in a way that they might not necessarily be involved for the other groups that are being looked at, that's an important kind of distinction, and also the capacity and coordination challenges of operating in a crisis context, and as well as the security challenges if it's a conflict or violence related displacement going on. Those are additional challenges, and the fact that the state might not have full authority, or in many cases won't have, that may be disputed. That's another challenge for social protection as a kind of state-led system. But beyond that, I also think it would be good to highlight the discrimination and protection risks, right? That is what defines refugees and IDPs as having these kind of protection needs that might not be common, that won't be the same as the other groups, the other breakout groups are looking at, and the fact that they might really face risks identifying themselves to state systems, and there may be very legitimate reasons why they don't want to make themselves known to the state. That's a big challenge that we found in in a lot of the research on kind of social protection for these groups that gets highlighted. But even if the displaced populations are willing to engage with state systems, I think the kind of political economy questions behind this are so much more complex for displaced populations than they often are for other groups, like inclusive social protection for women or inclusive social protection for people with disabilities, because especially if you're talking about internal displacement and conflict, that there will have been winners and losers in that conflict, and how that then plays out in terms of government officials' willingness to effectively serve that population is quite a challenging factor. So those are just a few general points just to make sure we get them on the board. And I'll put a link in the box to, if anyone's not aware, ODI has been working with the World Bank and with many other partners, including, I can see several who contributed to the research on the call here. We've been doing a big project on social protection responses to forced displacement, and the case studies from Greece, Cameroon and Colombia are all out now, as are some thematic papers on this topic, including on kind of access to practical access to social protection for displaced populations. So I'll just put the link in the chat. Thank you.
Thank you very much, Christy. And Rebecca, I see that you have your hand raised as well. I think before I call on you, I just point out we have about 15 minutes left in this breakout room, which hopefully will be enough time to turn our attention to three kind of priority areas. So I just want to plant that seed. I've entered it into the text. We want to, after Rebecca shares her input, I think we want to turn to a discussion of what our priorities as a group might be in this area. Specifically, what are some opportunities for advocacy, capacity strengthening, and research and learning? Rebecca, please go ahead. And then Daniela, I see your hand raised also.
Thanks. Yeah, I just wanted to build on a couple of points that others had said as well, and just thinking about how inclusion plays out differently and how experiences of displacement differ by different population groups as well, and just thinking to the intersections, especially that Ruth was talking about earlier, and thinking about that in terms of displaced populations. And I think, as Christy and others mentioned, that the types of risks that displaced populations are often exacerbated or different, especially around protection, and then thinking about how those risks play out for younger populations, for women in particular. And I think highlighting some of those in terms of what types of then social protection programs can deliver and support, or what additional services are needed to be linked to within a social protection system is really important. Just thinking about some of the issues that children face, for example, in being separated from families, or the significant challenges that they face towards getting an education, which then has knock-on effects for employment opportunities, obviously in the context of legal rights, but also just in terms of longer term thinking about the transition from children into adolescents and adults as well. And thinking about the evidence which is emerging around particularly girls' risk of gender-based violence, of early marriage, early pregnancy in displaced contexts, and just thinking about those sort of transitions, but the intersections between sort of displacement, but also thinking about age and gender and those other issues as well.
Thank you very much, Rebecca. Daniela, do you have a few words?
Yes, maybe I'll quickly come in. I think we had colleagues from UNICEF in Brazil joining, but I think they may have ended up in another group. So maybe just to, and that's going already a bit at looking at priorities, looking at capacity building to service providers. So thinking of a context like Brazil, where by law migrants have full access to the social protection systems, but really teasing out what are some of the barriers when it comes to lack of coordination or lack of protocols and workflows among the service providers. So that's one of the points I wanted to raise. And then thinking of intersecting forms or intersecting factors that are coming together together. I think we've touched upon this already, and I'm thinking of the context in Ukraine and, for example, specific barriers that are displaced Roma families are facing in countries that are hosting Ukrainian refugees. And also thinking, I think that leads back to the aspect of capacity building of service providers and addressing discrimination. And then lastly, one point to think about is different stages of displacement, and also teasing out the role that social protection can play in context of return and reintegration to really ensure that return and reintegration are sustainable, and the need to really make sure that across different sectors, different services, we're ensuring that we have a coordinated approach and really leveraging the role that social protection can play to make return and reintegration sustainable. Thank you.
Yes, thank you for that. And I understand that we're trying to rush this along as best as possible, but I think turning now to those areas of prioritization, obviously each of these country contexts and institutional environments are quite different in terms of their ability to provide social protection. So I want to just bring this group back. In addition to areas of capacity strengthening, are there specific points of advocacy that we should really focus on in improving the inclusion of displaced populations in social protection systems? Likewise, are there any high priority research and learning objectives that might inform programming in this area?
Might jump in very quickly. One point around advocacy, just from the experience from Ethiopia at least, which I can speak to. I think one area was kind of the concept of, discussing equity and cohesion issues, because of course, when you have huge amounts of IDPs emerging out of conflict, there is a lot of issues around stability, cohesion within the communities where these IDPs are moving from one place to another, especially with their lack of resources. So I think that was one angle when discussing with the government, is trying to raise this profile that we can't simply ignore a growing IDP population by simply saying that it's too difficult to get resources for them or to track them and understand where they've come from or where they're going to. So I think that was one area that we felt particular in conflict, but also drought response. We in Ethiopia have floods, droughts, and conflict at the same time right now. So resources are extraordinarily stretched. But I think that is one area where we were trying to promote this idea of, more around IDPs. Refugees is a bit more difficult, but particularly around the IDP population, that was one area. So equity and cohesion. Thank you.
Thank you very much, Matt. Others? Tanya, I see your hand raised.
Yeah, hi. Maybe I will say one for each of the questions you are asking. So I will say for research, I find probably maybe there are, but I think there is a big gap in informal social protection. There is a reality. The system doesn't get everybody within the system. Not all the mass migrant population, for example, get to obtain a legal status. So definitely these people, probably is a large amount of people in every country, they don't get to access the legal status, and therefore they cannot access social protection. So what happened with these people? What do we do with them? And which kind of forms can you find to social protection? And how far is the social protection and continue to be humanitarian protection, humanitarian response? How much is responding within the community and social kind of this kind of networks that we know family and other migrants provide? Is this social protection? I think there is a huge gap in this kind of what we call informal social protection. I don't think we have a lot of clarity, and I think we haven't identified the different ways of doing it, because if we don't have these kind of categories, it's so difficult to put them in place, to name them, to study them. So I think there is a huge gap that I would like, maybe if you can do more about that. I think that is very important. Regarding capacity strengthening, I think the state, the authorities, they need a lot of operational support, specifically at the local level, because we have a lot of poor people in every country. Of course, I talk from Colombia, but I know it's the similar situation in other countries. We have a lot of need, a lot of poor people, the local. After the COVID, we have more people, and the local authorities, they have the same capacity. And also we are asking them to receive migrants. So there is really a need for operational support. This is a kind of thing that I do here. It's a priority for us to provide operational support to roll up our sleeves and help the government to do the job, not just to talk and provide technical assistance and strategic thinking. No, we have to do the job, and also because it costs money, it is expensive. So I think we have to do that. And the third, with advocacy, I think it has to be more kind of for the whole of the society, because the national government can have a very good ideas, a very good intentions, massive regularization, trying to get the people within the system, even trying to adapt the programs and everything else. But if you don't have the kind of acceptance from the people, from a local civil servant in a very small municipality, there is not going to be any effort to integrate migrants. If you have the private sector, you have the landlords, and they don't recognize the permit, for example, they don't want to accept. If you have the banks, for example, they are complicated. If they don't want to accept the permit, like a very important document in order to open an account and they can receive the cash transfer and everything, is so complicated. So I think advocacy has to be to the whole of the society. I will leave that over. Thank you.
Thank you, Tanya. Christy?
Yeah, these have been really interesting points so far. I think there's lots, obviously as a researcher, I think there's lots of areas that we could see more research on, but one of them is a topic that ODI has been working on with UNICEF and the wider Prospect Learning Partnership, and UNICEF led by Daniela, who's in this group. It's been a really interesting project looking at kind of the case for inclusive social protection, and one of the things we found while working on this is that we're still quite premature in being able to quantify or rigorously demonstrate the benefits of inclusive social protection in regards to inclusion of displaced populations. And so there's a lot of benefits that I think we know will potentially come from, for example, refugee children being included in social protection systems, but actual studies really being able to demonstrate that in a way that governments can't kind of ignore are quite sparse. So I think that's a big kind of research need. And also within that too, we know that different kind of subgroups within the displaced population have very different needs and different experiences of accessing social protection, where they indeed do have any form of inclusion. And so I'm thinking, there's lots of different dimensions in which you can break that down, whether it's, gender and age and disability, but also even differences between different types, refugees from different countries, for example. There's some really interesting studies. I've looked at quite a bit of Iraq, where there's so much variation in how refugees are experiencing this as the social protection system there, and also IDPs as well. And really being able to drill down on those differences, I think, would help us all in terms of then overcoming the barriers that the different types of groups face. So it's just a comment there.
Okay, thank you. Maria Cristina?
Sure, yeah, to just add to the long list of research topics, I think there's a lot of research happening right now on social protection, kind of shock responsiveness and forced displacement. And there's also, on the other hand, a lot of research happening regarding like migration and climate change issues. But I think not many things, many research pieces and studies that actually combine the two. So really looking at increasing social protection needs against the background of these changing migration streams and increased vulnerability of populations facing climate change. So also even IDPs, right? Even within a country, how people will have to move from A to B simply for survival. And so I think that as a research area, obviously that links a bit to my earlier point also in terms of advocacy, right? So we see tons of media outlets talking about climate refugees, and it's difficult to actually then address it if people don't really understand what the issue is and the lack of rights of those people. But then also kind of strengthening capacities of the different government counterparts, but also other development partners to actually look at understanding the different scenarios of these migration streams, both domestically and internationally, to take into account increasing risks of climate change. And so I think there's a lot of work to be done. And as often may be the case, we're probably only going to understand the issue once it's already there and we have to deal with it. And so I'm kind of hoping that we're going to get going on that research rather sooner than later.
Okay, thank you very much. This has been quite a lot of very rich input. I think, in the few minutes that we have left, I just want to kind of throw it back to this group to try to prioritize what might be the most important to pursue in the areas of advocacy, capacity strengthening, and research. So we have a lot of ideas in terms of advocacy opportunities, really focusing on equity and cohesion issues for IDPs and accessing resources, as Matt pointed out, certainly for advocating for whole of society changes to integrate people into systems, and then raising, I think, donor funds that might be used to leverage government partners in filling that gap. Among those, what would this group would say are key priorities? And we're asking you kind of to weigh in with an educated vote based on your experience. Hard to prioritize, I understand, given that it's all critically important. Where should we start?
Maybe around the resourcing kind of aspect, because I feel that the current situation we are facing kind of multiple crises. So I think you do need to bring something to the table, often beyond just kind of advocacy points and policy ideas, because a lot of the time the reality in the political economy at play is it's just not going to pick up a lot of those IDPs and refugees. So I think the combination of trying to leverage any resources that you can to bring to the table to try and then as a kind of act as a catalyst to bring government on board or other partners, and you can start to build a bit of a coalition. So for me, I think that kind of balance between some resourcing and the kind of drive from the policy angle is super important. At least that's from my perspective and the experience we've had in Ethiopia and a couple other places I've worked. But yeah, that'd be one priority for me, I think. But yeah, see what others have to say. Thanks.
Thank you very much, Matt. Just because we're limited in time, I'm going to skip ahead to say capacity strengthening. What are the critical priorities in the areas of capacity strengthening? Again, we have mentioned issues related to coordination among different service providers, of really providing operational support to authorities at the local level, and building the capacity of partners to understand different scenarios of migration streams and how that affects access to social protection. What are the key priorities for capacity strengthening?
I'm wondering if for capacity
maybe
development,
the two. Okay.
Now, I was just going to say, I'm wondering if for capacity development, the issue may be more at national level for now, because we may actually be facing an issue where at a lower level, people don't even have the right to access certain services. And so I think, it's always important to strengthen coordination. I think I'd be the first one to say coordination is key. But I think if people don't even have the right to access certain things, then coordination and discrimination happens at a different level, right? So I think actually looking at whether or how you can grant that access in the first place, and then, I mean, coordination would come afterwards.
Thank you. Tanya, you were going to say something?
Just quick, perhaps if we have to choose two, I would say coordination and operational assistance.
Okay, great. Thank you very much. And then turning finally back to research and learning, I think we've got a general priority that we need greater clarity between in terms of identifying these different subgroups, but going further than that, the barriers they in particular face in terms of accessing social protection and what might best serve the needs of these different groups. Would anyone have anything to add for research and learning priorities?
I think maybe just to emphasize, as we were hearing in the introduction, how displacement is becoming increasingly more protected, looking at the numbers of displaced persons over the years and how it has increased, just the way that we frame the discussion as social protection as an investment for the future, and that's, we cannot go on with business as usual. So I think that's a key in terms of how we frame the discussion, and also the research that we're conducting at the moment with the ODI to really being able to benefit the outcomes of inclusive social, to demonstrate the outcomes of inclusive social protection.
And
Thank
maybe
you
just
very much,
something,
Daniela.
maybe something else to note. Sorry, this is Lori jumping in. I think somebody raised that question of stages of social protection during sort of a migrant experience or displacees experience from initial arrival and through potential integration. And so I think understanding research, sort of better identifying what are the ideal forms of access to social protection. Of course, it's going to be context specific, but what does that look like across the stages of integration into a new place? And how does that line up? I'm still kind of interested in this concept of mirroring between the host community and migrants, and then as that integration happens, when might the social protection access look slightly different for, say, new IDPs or refugees or migrants in contrast to the host community? And when do those start to merge so that they're really the same kinds of access?
Okay, thank you very much, Lori. Now, any moment now, we're going to be drawn back into the plenary group where we report out on these priorities. I'll do the best I can to kind of summarize some of the points you've made, but I'm going to encourage those of you who've weighed in here to please do so during the report out as well. I think it can provide more detail to other experts in the room. So when we go to plenary, please chime in as I try to summarize these key priorities for our group. With that, while we're waiting to be drawn back into the group, let me just toss it back to you. Again, any additional kind of considerations, priorities for improving inclusion of displaced populations into social protection programs?
I would like to jump in before we jump to the room. I just get nervous because I think it's going to cut off. But I think now that some of you mentioned it, that we have different categories: refugees, IDPs, migrants. I think is very important because everybody has different needs. I think that is one maybe that is what we're missing, that I don't know if it's the right word or is the right word or the right pronunciation, but it's returnees, the people who goes and then who leave the country and then get back to the country. And I think this is a whole different kind of particular situation, and maybe we don't have also enough information about social protection for these other additional group of displaced people. Over.
Thank you very much, Tanya. Christy?
Yeah, sorry, maybe I'll be the one who will cut off on, but I really, Lara's point around the displacement cycle and when social protection needs to look different for displaced populations versus when it could be more similar. I think there's a big risk when people are talking about inclusion in social protection, that they really are just thinking, you know, not the people in this room, but wider policymakers and practitioners quite often think of inclusion as just meaning facilitating access to the social protection system that currently exists. And that's really not going to enough. Like that we do need to be thinking about adapting, and Tanya also mentioned this, actually adapting the social protection system to have a whole component of provision that is specific to displaced populations' needs. Like it's not, it's actually more dangerous to potentially just expect a refugee, for example, or a newly arrived IDP to be served effectively through a system that just wasn't in any way designed for them. So that difference between kind of integration and inclusion just in terms of access versus inclusion in terms of design and changes in the system itself, that is something that we really are keen to stress from the work that we've done on this so far, because it doesn't seem that it seems intuitive when we talk about it among people who care about this topic, but not to wider policymakers, I don't think.
That's a very good point. Thank you, Christy.
I work with the International Labour Organization in Nigeria.
Great, thanks, Shagan. I will just pass over to maybe Madeline.
Hi, can you hear me?
Yes.
I can't even see like if I'm on the screen or not, but I'm Madeline Smith. I'm with USAID Center for Resilience, which is inside the Bureau for Resilience and Food Security, officially from Washington, but I'm actually in the other Washington state on the West Coast.
Great. Is that very early for you then?
Oh yeah, I get up very early.
Well, special welcome then. Great. Okay, well, I think we have a fairly short amount of time to cover quite a lot. I think we've got one more addition to the group. Is it Orally? I'm sorry if I'm pronouncing your name wrong, but if you want to introduce yourself and correct me, that would be great. Thank you.
Hi, good afternoon. Yes, you're pronounced it right. I'm also working for the International Labour Organization in Geneva in the Social Protection Department.
Brilliant, fantastic. So without further ado, I think we have the task ahead of us is to really pin down the answers to three big questions. First of all, what do we know already? Second of all, where do we see the gaps and opportunities? And then finally, prioritization. So we have to kind of pick a couple of things that we think are really important in these sort of three categories. And thanks so much for bringing up this board so we can see the kind of three big areas that USAID is thinking about are advocacy opportunities, kind of capacity strengthening, and I think that can be kind of at multiple different levels, but particularly the country level, and then research and learning needs, and perhaps particularly around sort of, practical, concrete learning needs at the country level. So that's the grand plan. We have a nice structure, but we can sort of flex as needed. So we're going to start by talking a bit about what we know and then move into the gaps and opportunities, and I'll make sure that we protect time for the prioritization. So I think, are we supposed to be in the Miro board? It should be showing on your screen, Madeline. Can you not see it?
Oh yeah, I see it. I just didn't know if we're just supposed to individually type into it or just our note taker will do that.
I think Karina's just going to do that for us. Is that right, Karina?
Yes, that's right.
Great.
Oh, okay, great. Thank you.
Excellent. Thank you so much. Yeah, Save the Children are managing it all for us, which is wonderful. So the first question really is around what do we already know, and maybe just a couple of prompting questions to get the ball rolling, but really come in with what you would like to share. But one of the first questions was really around, what have we learned during COVID, the pandemic, and the kind of multiple overlapping crises that we're currently experiencing around the needs for young people, children, and women. What do they need from social protection systems? And what are we seeing in terms of, why are they excluded? In what ways are they excluded? But there's just probing questions, so kind of open to the floor. Welcome any perspectives on what we already know, whether it's about challenges, needs, exclusion.
I think, so I've worked a lot on social protection design in Sudan and in Malawi. I used to, in a previous role, actually, when I was working for FAO, I was an advisor to the government of Malawi to integrate social protection and agriculture. What I would say, some of the things I've seen in the targeting systems, you know, often women are indirectly reached. So, I mean, they may be reaching many, you know, female-headed households, for example, but the program designs themselves don't really go beyond that in terms of trying to address, you know, specific needs of women. And certainly one of the things that we were working on was, you know, how to really integrate a nutrition component, which really, or a nutrition sensitive component, which would really entail also, you know, reaching more women and, you know, pregnant lactating women. So those targeting systems and surveillance systems and a lot of the, you know, linkages between various, you know, databases, they could match up, but it takes like a whole additional layer of, you know, programming to really specifically get at, you know, nutrition and women, for example.
Yeah, that really resonates for me, sort of the kind of very minimal inclusion, if you like, rather than transformative approaches. Any other perspectives on this? Maybe take one or two other points and then we'll move on, just because we're a bit short on time.
Maybe as the point on databases came already up, that I think there's also an issue around data collection and really having also the information on how many of sex disaggregated data on coverage, on access, and so on. Because from the ILO perspective, where we're also collecting information on the SDG indicator 1.3, for example, for many programs, it's very difficult to have the coverage rates by gender, by sex. So for contributory systems, that might be more the case, but for social assistance programs, that's often missing. And then I think also linking to that, really making analysis that takes into considerations different needs or different trends on how women are covered compared to men. We had one very interesting study in Vietnam where actually the registration in the social security system of women was very different, as young women would be covered, but then taking out their savings and be out of the system to launch their own business. And then in the end, not having access to pension coverage or so. And really this analysis of the data by gender then showed those different patterns. But I'm sure my colleagues from the field have more input.
We're being encouraged to move on to the next board. So maybe just any final comments from anyone?
I would just say to add a bullet that, you know, similar conditions exist for youth, where we're not necessarily explicitly reaching youth and designing youth-centric programs, even if they are sort of indirectly included. I haven't so far seen so many that are really designed specifically for youth.
Yeah, I think that's absolutely right. The Tanzania Cash Plus program that I highlighted is really interesting because it's designed so explicitly for adolescents, but it's not that common. Let's shift to what are the gaps and opportunities. And yeah, we'll maybe start with folks who haven't come in yet. In terms of, yeah, sort of burning gaps or opportunities that you see, maybe especially in the field. Maybe let's start with the advocacy opportunities. Yeah, any sort of gaps or opportunities that you're seeing specifically related to gender inequality, of girls and women, or to young people and children.
I can come in on that. So one opportunity is to highlight the triple dividend of focusing on women. So for the women themselves, for their children, and also for the next generation. So that is an advocacy opportunity that has not been exploited enough.
Yeah, I think that's a really good point. And it works on so many levels as well, right? In terms of for the children themselves, next generation, for women, and also for economies. It's like a quadruple dividend. Any other reflections on advocacy opportunities?
I think having a message that really focuses on investment in human capital. I mean, we often, I think sometimes there's a disconnect in just the communications when people hear social protection, and this might be just in the US, but they hear social protection and they just kind of equate that to handouts, or that's some other program happening over there, So part of it is around just being able to communicate in ways that really resonate with a greater, variety of, audiences, and especially those who are, working on agricultural productivity, economic development, this idea that, an investment in human capital through social protection and the various services is a part of productivity.
I think that's a really good point. And if I may, my experience of working at country level in lots of places is that there's still so many myths about what cash transfers do or don't do, like, oh, it means that women are going to have more children. And so, well, first of all, that's their choice. And second of all, the amount of money that these programs are, delivering is not going to make the difference in someone choosing to have an additional child. And we know that from the evidence. And there's like lots of other myths, right? Like kind of dependency, or like spend it more on tobacco. But there's something there about, it's not just about, if we can capture in the notes, I think the point about like the message about productivity and human capital as opposed to handouts. Because I think that it's like it's a thing we've always been grappling with, but it's still very resonant. What about on capacity strengthening? What are the sort of key gaps that you're seeing? I don't know, Shagun, if you had any thoughts on this from the country perspective.
From my experience in Malawi, Sudan, even the Sahel, in terms of the government, level, there's still, there's a lot of capacity that's brought in through the international technical working groups. I would say, the governments are still very short-staffed in terms of their own ability to not just finance the social protection system, but, actually really take on the major roles in implementation. I can say, Malawi has a really strong coordination committee, but honestly, they only have 5 people, and they're managing this gigantic program. So I think that there's still quite, a long ways, to go when you consider just the complexity and the diversity of the kinds of adapted, safety nets that we want, that, are important to promote. So just, staffing, management, just overall, program direction.
Yeah, absolutely. It's like sheer numbers of people are definitely a part of it. Shagun, you're unmuted. Were you trying to come in?
Yes. Thank you. I actually want to comment on the advocacy opportunities. For countries, majorly in Africa, that are facing security crisis, there's ongoing realizations about how women are involved in peace and security, and this is a very good thing that we could leverage on, and when we leverage on this, we can now use how social security can foster social cohesion among communities that are affected by war or affected by this insecurity crisis.
Yeah, I think that's a really good point. It feels like, I don't know if this resonates for other people, but sometimes the community that's pushing on gender equality or on child rights is not as often connected with the network of people that are working on social protection and resilience, unless it's through like a very specific lens around like child labor or something like that. And so there's something about bringing together those communities. Any other reflections on the capacity strengthening needs?
I would also add that there is certainly a need to strengthen the capacity for just data security, digital, developing social registries, managing those in a safe way to protect, to get the information and, link various, MIS, systems, but then at the same time, just the issue of data security is a really major challenge, I think.
Yeah, absolutely. Shagan, over to you.
Yes, thank you. I think in the area of capacity strengthening, it's very important that we strengthen capacity around social dialogue, because what we have seen in Nigeria here is that when most of these social protection programs are developed, they were developed with just the idea of the government. Most stakeholders are not involved in the process. And at the end of the day, most of the programs are not able to serve was originally designed. So it's very important that all stakeholders are involved at the beginning. And these are the process for social dialogue. Thank you.
I think that's a really good point. I've been very struck. We held a consultation with feminist organizations recently on a program, and how when we shared it with our Social Protection Interagency Cooperation Board, and loads of different partners were immediately like, can you share the list of people, because we don't know how to do it and we don't know who to reach out to. And I think that's a really common experience, even at kind of a regional or global level, because there's not that many feminist organizations exclusively focus on social protection. Like there may many from a kind of gender-based violence, child marriage, girls' education, women's empowerment point of view, but specifically social protection, not so much. And so I think we need to do a lot more. That really resonates with my experience. And I think the same thing with children and youth groups. There's a lot of anxiety around how to do that in a way that's safe. And I think also that kind of dismissal of young people's views, they're not kind of seen as having relevant ideas yet, which is obviously a complete misnomer and mistake. So yeah, really good point. Any other reflections on this, or shall we move on to the third category?
Yes, another reflection. I think also nation is majorly discussed at the strategic or the political level. Coordination at operational level, and so there's lack of various institutions who implement social protection programs. So I think it's very important that we also build capacity around operational coordination. So coordination at the operation.
Yeah.
Operational coordination?
Yeah, I think it's a separate point to the capacity to kind of have kind of inclusive processes for design. Awesome, thank you. Moving us swiftly on to the research and learning needs in the interest of time. What do you all think about this? Are there specific questions around design and implementation that regularly come up in relation to gender inequality or reaching girls and women, or for children and youth? Other kind of regular questions, or regular asks for case studies, or, what are the kind of gaps in research and in learning that you're seeing? I'm sorry, I can't see you. It's the floor of this setup, so I can only see hands. So yeah, maybe either just open the mic, or if you can stick up your hand, that will help. I can't see me or
I know
you.
I can't see myself either. I was wondering if you could see me.
Yes, I can see. When people speak, I think your camera comes back, but otherwise it's a blank slate. But anyway, over to you, Madeline.
Yeah, gosh. I mean, I think there's, it really resonates with me that there is a need for more research and just, proof of evidence on how to really scale up some of the programs that we know are out there. I mean, I think that we certainly have, social protection systems that are reaching women, but there's more, research needed in terms of not just reaching the ultra poor, not just reaching, or, in being more inclusive in terms of, reaching, the, people living with disabilities, and their households. I guess, maybe more research is needed in mainstreaming it so that it's more accessible to a broader number of actors who may not be involved in actually implementing the system, but they could be users, like the private sector. If we, as we invest more in graduation programs, how do we do better to link private sector actors into that program as, being able to engage the people who are, who are direct, beneficiaries. I don't know, I'm trying to kind of, couch that in, better terms, but in a way, I guess there's just more is needed in terms of expansion on, smaller programs that we have, mainstreaming, research on, how to expand graduation systems in a more, efficient, effective, and, kind of long-term perspective, so that we can really cost out, what this long-term vision, looks like, and make it more accessible to more people.
Yeah, I think that's a really good point. And just for Karina, I think there's probably like two, maybe three different gaps there, or kind of opportunities. Maybe one around expanding the evidence on how to expand smaller pilot programs, and one around the linking to private sector actors. So I think that last bit is the bit with the second bullet point at the moment. Others, I can see your hand shaking, so over to you.
Yes, thank you. My thought would is around the current reality about the dwindling fiscal space for social protection, and not just for social protection only. Governments in low and middle income countries are complaining they do not have resources, and as a result of this, social protection expenses have to compete with other expenses like paying of salaries, construction of roads, and all of that. And it's very important for us, if we want to see increasing investment in social protection, we really need to come up with additional evidences on why social protection is an investment, and why government should invest in it. So I think more work needs to be done in that area. And another very interesting experience I would like to share is that in Nigeria, we are working very closely with UNICEF and on a joint SDG program, and leveraging on the resources and the expertise of both institutions. There's a state in Nigeria called Sokoto State. We've been able to, support social protection institutions in the state, And the very interesting thing is that we, through the joint SDG program, we've been able to extend health insurance to pregnant women, and also support the women with cash transfers. And this has really, made very, very huge positive impact. And it has made the government of the state to want to, invest more and continue the program even after its closure. And I feel that programs like this would help strengthen the government confidence on where social protection is it's an investment.
So is your suggestion here like case studies of these sort of models that have worked well? And that's
exactly.
Yeah. Okay, great. Frank, I'm wondering if I can put you on the spot and bring you in, given that you're working for the Office of Research. Any reflections on urgent priority research or learning gaps, either for gender or for age?
Sure. So I will reinforce Segun's point about the investment case and then fiscal space. So we definitely need to do more studies about how governments can create a fiscal space to invest more in social protection. I kind of feel all the governments are sold out. They believe in social protection. They know the importance of it. The only good question is, where's the fiscal space and then the financial resources to do it? And in line with it, I keep thinking of avenues for innovative financing. So how can we be very creative in how governments can finance social protection? For example, one idea we've been floating is a 1% VAT tax that is dedicated to social protection. For example, is this something that we can do more research on to push across the board, that if every government had 1% of their value-added tax going to social protection, how would the world look like? How would this expand coverage and reduce the gap in social protection flawed financing? So that's definitely one of them. The second one is also testing different modalities of social protection and integrated social protection systems. So again, we know most countries, the social protection system has evolved organically. You can have a health insurance policy there. You can have a cash transfer there. You can have some even go to agricultural subsidy or school feeding program or fuel subsidy or food subsidies. But there are a lot of opportunities for moving one to strengthen the other. And there's a case, an interesting case in Tunisia, where the cost of the fuel subsidy is about $2 billion. If you cut that and give it directly in terms of cash, you reduce poverty by 4 percentage points versus the fuel subsidy that compared to continuing the fuel subsidy. So in various countries, do we have this opportunity for budgetary reallocation for the social protection portfolio, not necessarily increasing the expenditure, but making it more efficient and effective at reducing the gap in social protection coverage? Yeah, this would be the two.
Sorry to cut you off slightly, but I'm just conscious of time and I'm getting alerts telling me to move on and wrap things up. So I think that's really helpful detail, and I think it kind of gives some meat to the bones of the idea of this kind of why social protection is an investment. I just want to make sure that we're pulling out very specifically the inclusion angles of that. So maybe specifically around the investment case for expanding to cover excluded groups, and just for Karina to flag it. I think the idea here, the case studies idea, is a separate one for Nigeria. But we need to hone, I know the ask of USAID is very much to hone in on two sort of priority ideas for each of the categories. And so I asked Karina because a couple of people, well, two people had sort of highlighted the investment case as a research gap. And so as that's kind of organically come out as something that's been raised a couple of times, maybe that's a kind of natural candidate for one of our priorities. But I'm wondering, any reflections on, maybe we can start, because it's hard to see both at the same time, from our ideas in the research and learning gaps, are the kind of key things that stand out to people as sort of our top two. So looking through the list, Karina, do you mind just shifting us slightly to the left so we can see the list? Thank you very much. So sort of, I think a few ideas that came out, Frank's sort of second point actually isn't in there yet, but so I think there was sort of an idea around testing different sort of how to scale up smaller programs, how to link to private sector actors, the investment case, which Shagan proposed and Frank has expanded on, the sort of case studies idea, looking at what's worked well, for example, expanding to pregnant women, a cash transfer program, and then finally, Frank's point about testing different modalities, so looking at like what are kind of the most effective combinations, whether it's cash plus health insurance plus school feeding or something else. So yeah, wondering any reactions about, you know, what do you think would be particularly strategic priorities from that list?
I can't actually read the text is so small, I can't read it, but well, I definitely think a priority is the financing, that last one on, you know, how the financing modalities, looking at ways that, you know, research can really show evidence and steer, you know, governments towards, you know, shifting investments in social protection.
Yes, I think Karina, that's the same point. I can't, for some reason, it's blocking what you've got in the first one. It just says research on how social protection for me, and then I can't see what. But so point one as a priority for us is around investment, finance modalities, yeah, how to make the case. For different funding models. I think we can group those together. And from the shortlist that is now, that we can't now see, but in terms of case studies or testing different modalities, different sort of components of a social protection program or system, and what's a kind of effective package, or the expanding of pilots, what would folks in the room feel are particularly piercing priorities?
Well, again, I would say that just having, you know, scaling up the, you know, evidence on youth focused social protection. What does this really look like in different, you know, considering a lot of, you know, different contexts. And likewise for gender, I mean, I would treat them separately. Often they get kind of lumped into the same, you know, sentence. But certainly looking at gender and nutrition and you know, human, like the human capital investment, I think would be a real high priority.
I think, and gender, Karina, just for that extra post-it note. Great. I know we're short on time. It's very like a lot to cover in a small time. So maybe we'll just go into the capacity building, which again, we had quite a long list. I encourage, and orally, we haven't had from you for a while. So if you have any reflections on this, I'll start with you. So yeah, we've got a few different ideas in terms of sheer capacity, kind of sheer numbers of people, especially at the local level, capacity around data systems, inclusive sort of social dialogue around design and implementation of programs, and then operational coordination. So there's sort of 4 distinct ideas, and just, yeah, wondering reflections on top 2 to prioritize.
I think for me, the data one would be quite important, because I think also for the advocacy, like if you don't have good information on what you're trying to do or what doesn't work or why it would work, I think then it's difficult to develop your advocacy. And I think a second point, also building on what Segun has been saying, I think it's really important to have support by multiple stakeholders. So really having a social dialogue that is very inclusive of of course, they're the main group's concerns, but then I think it could also be an opportunity to link with the private sector, or like getting really a whole of society approach also to support the social protection advocacy. So I think that's something that then would also need capacity strengthening for the different groups that should participate, because I think sometimes there's a divide between, I think, different sectors, or maybe also the development sector and general political dialogue in a country.
Yeah, absolutely. I think that's a good case for top 2 priorities. Any other reflections from the room? Does that feel right? Or counter offer, counter pitch for another priority?
No, it sounds good.
Great. So Karina, that's the inclusive data systems and the inclusive social dialogue with those 2. And then I think for the advocacy, we only had 2. I think, which was the sort of triple dividend narrative, or quadruple, depending on. Oh no, we have 3. Sorry, my memory. So yeah, any reflections on this? Where we'd want to prioritize, whether it's about kind of weaving in the sort of peace and security narrative, and making the case for social protection as a tool for social cohesion, around sort of a positive narrative around human development, human capital, and productivity, as opposed to the kind of myth of it being kind of handouts and dependency. And then it's a triple dividend narrative. It's an investment for women, children, and the next generation, as well as economies. So yeah, any final reflections on what two we should really highlight?
I think addressing the different myths and debunking them would be quite important, because I would consider that would lead to more societal support for social protection, and then hopefully also for demands for greater investments.
Which 2? Sorry, I heard number 2. 1 and 2.
I said number 2.
Sorry, I can't quite hear you. Is it 1 and 2, or 3 and 2?
So the one that are to address the different myths around social protection, and to make sure that the greater public, or the variety of audiences, really understands what it does and what it can do for preventing poverty, for reducing inequalities, and so therefore contributing to more advocacy for social protection.
Got it. So strong case for number 2. I don't know whether linking with the private sector, that's not one of the advocacy points, Karina, just to flag. So we can remove that one. But yeah, focusing on a narrative for human capital development, and a kind of positive narrative for different audiences, and tackling the myths. Any others feel another priority, one of the other ideas really sticks out that we should feed back to the room? Part of me feels like we can maybe cheat, because I know the next consultation is on social cohesion, so we know that will come out in the next one. But I think if we felt like, all 3 of them need to stay, then I think we're allowed to be slightly flexible about top 2. But yeah, any final reflections on this would be great.
I think it's good.
I also like the link with the conflict and the role that social protection and women can play in that, in conflict prevention or post-conflict situations. Because I think it's very high on the agenda in several countries where we would be working.
in what way, what's the sort of, yeah, how would that translate in terms of social protection? Is it the idea to, yeah, well, I won't put words in your mouth, but yeah, what's the kind of link with social protection that you would suggest?
More awareness on the role that social protection can play and how you can implement social protection in humanitarian situations, but in taking this longer term perspective. I think something you also mentioned in your introductory remarks.
Yeah, that totally makes sense to me. So maybe it's sort of about, you know, social protection in conflict settings, women's empowerment being central to social protection in conflict settings. Maybe that kind of sums up.
I think that, yeah, the women's empowerment and really having gender specific components of shock responsive systems so that we can, you know, maybe better address some of the preventative, you know, measures where women are, you know, they certainly just become more marginalized. But just, yeah, generally speaking, in a, you know, integrating social protection in a conflict or fragility, you know, setting that's, you know, really focused on women and girls.
Yeah, absolutely.
I mean, I know we don't have room to list everything, but we often, I mean, we could just say and youth too.
Yeah.
But they're not necessarily like all one program.
Yeah, absolutely. I found it very difficult in the introductory PowerPoint. I also find it challenging in this group because we could have had easily like 3 different groups, one on children, one on adolescents, one on women sort of / gender inequality. But yeah, I think that makes sense to me. So young people, women's empowerment, central, should be centered in social protection work in conflict context with sort of gender specific, youth specific design and so on.
Right.
My name is Louisa Lippi. I'm an independent consultant. I'm working with UNICEF at the moment on strengthening disability inclusive social protection. I'm going to facilitate this section and I'm joined by Logan Noonan, who's going to be taking notes. Logan, do you just want to introduce yourself very quickly?
Sure. My name is Logan Noonan. I am the program specialist with the IDEAL project, which is a very closely kind of sister project to REAL. So I'm just here to help take notes today. And please, if you see me taking notes and you want to make sure that I capture something how you meant it, please feel free to interrupt me.
Okay, I think what we can do instead of having maybe introductions for everybody at the start, maybe when you have something to say, you can just introduce yourself first before you intervene, and then we can do introductions that way to save a little bit on time. So the breakout session is organized in 3 parts. The first, we will have a brief discussion on what is already known about disability inclusive social protection. This will be very brief since we're a little short on time. Then we're going to do some brainstorming on what are the gaps and opportunities in 3 different areas. The first is advocacy, the second is capacity strengthening, the third is research and learning. And then based on that brainstorming, we've been asked to prioritize key recommendations for each area, which will then be presented back in the plenary. So maybe I'll just start very quickly on setting the scene on what we know. So one of the things we know about persons with disabilities is that they definitely have lower incomes and savings, weaker social networks, fewer assets, and less attachment to formal employment than those without disabilities. They also have greater expenses due to disability-related costs, like assistive devices, health services, rehabilitation services, transportation, personal assistance, which lowers their disposable income, which in turn lowers their standard of living. As such, they have greater exposure to poverty. they encounter lots of barriers when trying to access different social protection schemes, either in terms of program design, so things like the eligibility criteria might be very narrow, looking at persons with severe disabilities, persons with disabilities who are living in poverty, focus on the medical model for assessing and certifying disability, and then the operational components of those programs as well. Things like inaccessible pay points, lack of awareness, communication to persons with disabilities, which again reduces the accessibility of services. These factors combined reduce the resilience of persons with disabilities to cope with shocks and stressors, both idiosyncratic and covariate, putting them at a much higher risk for falling into or deeper into poverty when something happens. And we saw this with COVID-19, and this has certainly exacerbated their vulnerabilities across the board, putting them at a higher risk than the general population. So we thought we would have a brief conversation, given these highlighted risks, thinking about what do people with disabilities need from a social protection system? Where are these systems falling short? And then also going to a lot of you who are working in country offices, it would be really interesting to hear what are some of the factors and building blocks that have enabled inclusion in government systems. These can be political, financial, administrative, whatever, and sharing those examples about what worked well in different countries. So that's the opening to the discussion. That was a lot of me talking. So hopefully you will take the rest of the talking for this about what do we know. So does anybody want to come in, just unmute yourself, I think, and introduce, or I think I don't know, I guess you can raise your hand in Zoom as well, about what if you have any, what kind of barriers you've encountered in your work on disability, inclusive social protection, and then, what has worked well? What are some of the things that that have been successful?
Yeah, maybe I might come in. I'm the ILO Social Protection Officer, a focal point of the person with disabilities one. Maybe looking at this slide, I think one of the things that we concerning is like the compatibility of the disability benefit scheme, that including compatibility with work to receive disability benefit, or compatibility with the disability allowance to receive, together with the mainstream social protection scheme. Because otherwise, as Louisa said, like the disability extra costs cannot be covered. So I think for advocacy's opportunity, maybe it's good to mention like the compatibility with work and then compatibility with the social protection. The other social protection scheme. I think that can be the really important thing. And then now other countries not really, doing that. ILO is also, counting how many countries are like having the compatibility with the work to receive the disability benefit, but not so many countries are actually doing that. Thanks.
Alkera, do you want to go next?
Yeah. Thank you, Louisa. Hi all, and sorry, I might have a little bit of noise here because my family is on vacation, so I just try to find a quiet spot, but thank you, Louisa, for providing me this opportunity. Actually, I'll just like to talk about the recent examples of UNICEF trying to implement a carers benefit program, which is a cash transfer program to the carers of children with disability for Ukrainian refugee children. A very interesting experience. It just started. Actually, the work now started there to do the assessment and to transfer the payment. But very interesting example, which actually highlighted a couple of issues and challenges that we are discussing today. So I thought it's worth mentioning here. Slovak government was very interested to actually provide cash transfer programs to Ukrainian refugees. Of course, I'm not going to mention all the principles and the rationale for doing that. So UNICEF stepped in and helped the Slovak government to to design the program for the children with disabilities. The initial assumption was, or the initial request, let's say, of the government was, well, we know that, okay, children with disability that have a carer, and because of the carer cannot work, you know, would it be important to give the benefit as a compensation of their lack of income and of the needs, financial needs that they have, given all the additional costs that children with disability would bring. For UNICEF, though, was very important to actually consider it. So the request was, well, all the children with disability card, you know, please put them in the program and provide the carers benefit to these households. For UNICEF, it was very important right away to actually discuss, well, I mean, why we would be giving this benefit and who would be benefiting from it. I mean, just the fact that the child has a Ukrainian disability card was not actually enough for UNICEF to develop the program. So for us, it was very important to develop a very clear assessment tool and to introduce the child functioning module with the assessment tool, which was actually well received also by the Slovak government, and we felt that there was quite a lot of advocacy moment there, which went very well. Also, we felt that the child function module, okay, would give us a sense of, okay, what are the children among the Ukrainian refugees that are having mild.
Oh, Alkeda, we've lost your sound a little bit.
Oh, sorry. Okay. Can you?
You're back.
Can you hear me
You're
now?
back. Yes.
Okay,
yes.
sorry. So, okay. So the assessment was important for us, and actually we advocated with the government that the assessment should be based on the child function module, which still was again not enough when we designed the program element. So we thought that the assessment should be designed in a way that we could capture the needs of children for assistive devices and the needs of children for the for services. The agreement with the government was that, well, we will support 3 months the care benefit, and we'll then hand over the caseload to the government. So we actually opted to develop that assessment in a way so that whenever the caseload of children with disabilities transferred to the government, they get an overall picture of all the needs of children with disability and the households they're living in so that actually whatever system that they will be supporting to be actually inclusive and considering needs. So for us, was also important to develop clear training methodology for the partners that do the assessment, very clear communication material, which I think was really appreciated from the government, because the communication should be targeting different audiences with different messages. Was one, of course, first and foremost was important to a communication campaign to reach out to all the households with children with disability, so that they know that there's this program and they know how they can actually, what are the steps to take until they receive the benefit. Important to say here, we considered the accessibility issue. So the assessment will not be done with a child, but with a carer. So there was no issue actually or barrier for the children to access the assessment points. And but on the other, I mean, parallel to that, communication for the Slovak public was very, very important as well. I mean, we're talking about social protection budget who is paid by taxpayers who would go to Ukrainian refugees in 3 months or 6 months time. So we really wanted to actually use that momentum to build some solidarity and to give very clear communication to the Slovak public about the importance of this program.
Alkeda, I want to give just other people a little bit of time.
I finished. Okay.
Because
we're
running short.
Just one last word on my side is that we actually, parallel to that, we started exploring the opportunity of services, but clearly one of the gaps was the service coverage. It was a gap for the Slovak, population. So it's one of the gaps that the children with disability will be facing as well, including the Ukrainian refugees. So, okay, sorry, Luisa. Thank you.
No, it's really good. And maybe, no, it's really good. Logan, maybe I can just summarize very quickly for the notes, the point. So the first point would be on for advocacy and also maybe capacity, both in the same spot, would be on the need for the functional assessment versus the needs assessment. So most countries, the functional assessment to determine eligibility as opposed to the medical. Slovakia has a medical assessment right now, and UNICEF put in place a functional assessment for the program. So we need to advocate with governments to move from medical to functional, because the functional gives us a greater understanding of the full needs of the person or the child with disability, in this case, like assisted devices and other services. So we need to advocate with governments on that. And then the capacity strengthening in terms of what Alkeda was talking about with training the enumerators and also doing outreach and things like that to make sure people understand. And I guess maybe it's also a little bit on kind of capacity and advocacy is on in refugee situations, making sure that the host population understands the point of the program, as well as the beneficiary population, not to create social tensions. So those would be, I guess, the big blocks that and then the other thing on capacity strengthening and research, I guess, would be on the services. So Slovakia has a very constrained service for persons with disabilities. They don't have enough for the Slovak population. So there needs to be more strengthening of the capacity of the system to provide services, not only to the system, but then also to the refugees. Yes, it's a very, the system is very generous, but if you need services, no matter the money that you get, you're not going to be able to access if they're not there. So, so those kind of a quick summary to aid with the note taking. I'm going to turn it over to Alradi. I see your hand up, so please go ahead.
Hi everyone, this is Alradi Abdullah. I work as a disability social protection, disability and social protection focal point with the International Disability Alliance. Just before I go to my point, I will add to the assessment here. Beside the function, we need also to focus on the support requirement because as a function will identify the functional limitation, but we need also to see the support requirement for that person to access services and to participate equally in society. So my point is about the confusion around disability-related cost. In many cases, disability-related cost, as you mentioned earlier, is not really counted. However, even when it is there, in many cases, there is a confusion between disability-related cost and the function or the schemes that support the basic income security. So, for example, in some countries, you will find that there is old pension, and there is disability pension. But as an old person with disabilities, you should access either the old pension or the disability-related cost, forgetting about that each pension here, in this case, support different function. As the old pension support like basic income security, while disability pension supports the disability-related cost. Not to forget about historically, the disability pension has been established as a compensation for a worker who are not in a position to continue their work. And this is still a discussion that seeing a disability allowance or disability programs as a way to compensate persons with disabilities that are not in a position to work. In another word, when this program put in place, they put a condition that if persons with disabilities in the capacity to work, they will be assigned this benefit. This approach actually, if you look deeply, is not supporting the inclusion of persons with disabilities, rather supporting the segregation. That's mean stay at home and will provide you with some social protection. And given the fact that persons with disabilities if they would like to participate and to go to work, they will spend more because for me, for example, as a person with disabilities, to work, I need personal assistant, I need assistive devices, and if I stay home, I will spend less. So all this story to highlight that we need to have clear direction for service providers, for policymakers, that persons with disabilities should be accessing disability-related costs beside the other social protection that support the basic income security. And indeed, I agree about the issues around accessibility, around disability assessment, in particular about disability assessment. In many cases, as mentioned earlier, it is quite focusing on medical approach, and in many cases there is no integrity around it, and also the system of disability assessment need to be integral part of the national registry, national civil registry, in order for policymaker to have clear data for budget planning, policy planning, policy making, and so on. So this is in very summary, and then I can get back later again. Thank you.
Thank you so much, Aradi. Susan, did you have your hand up? Did you want to come in with?
No, sure. I'll share the Kenyan experience and what our priorities would look like, probably, if you allow.
Yes, go ahead.
Yeah, so what I've seen, I don't know, I'm going to coin the points. I hope I don't confuse Logan with her note taking, but I would say that what I've seen work very well is the evidence we generate from research contributes greatly to the advocacy opportunities. For example, we've been able to generate a bit of data on disability, and this has gone into the National Social Protection Strategy, and we do have a consideration of persons with disability interventions. And we are developing our medium-term plan document that would guide now, as you know, we're in the transition moving to a new government come in August. And this evidence on disabilities has been good to contribute to the medium-term plan document that also will be a contribution to the development of the flagship programs for the incoming president. I'll also say that as Kenya, we are moving towards also having advocacy around UNPRPD compliance. As we know, we are fully, the country is not fully compliant because students still need to be assessed to be placed in schools. We still need the medical officers to do the assessment and for them to access the disability cards. And this of course has been a barrier to children accessing social services, not only social services, but also access to schools. And these are discussions we're having to see how best then this can be supported to ensure the compliance and also increase access for these vulnerable groups. The other I'd say is the capacity strengthening, where we've seen gaps even within the caregivers, where they're not so sure on how to handle the persons with disability, especially children, and also what the risks these children are exposed to. So seeing how best then we can have a capacity building for caregivers and also for the those who are providing services. We did have this experience in one of the programs when we were doing registration for children with disabilities, and we did see the handling that wasn't quite in a good way. So there's need for that. In overall, also bringing in the capacity strengthening around the policy makers on disability language, on how to be sensitive and be accommodative as well in meetings, in discussions and engagements as well, so that we are all inclusive as we have discussions around this. Also, we're moving towards advocacy around universal child benefit, and one of the pillars we've focused on is having a disability pillar to generate evidence on how these children also with disabilities can be included, not only to access the services, but also to access the rights just like any other children as well. Thanks, Louisa.
Thanks so much, Susan. Yuta, I think you had your hand up as well.
Yeah, thank you so much. No, just a really small point for the note for the advocacy opportunities for the first part. Logan, could you kindly make it not only the other social protection scheme, but also compatibility with work? Because ILO is for the first point of the advocacy opportunities. Then compatibility with work, and then I always what the ILO is counting is the how many countries do the compatibility with work. Still find it difficult to do the compatibility with the other benefit. Anyway, then another point is like for the capacity strengths. I think every countries find it really difficult to do like their disability assessment. Some people already mentioned, but for example, it's good to follow like not the medical approach, but the more like whether they can do a daily activity or not. This kind of like what to call Washington group short set is often used for this sense, and then each country should have the capacity in doing so. Yeah, Washington group short set. It should be referred or something like that. Washington group short set. Yeah. Yes. Yeah, that's all for me. Thank you so much.
Alradi, you wanted to come back in?
Yes. So as the opportunities, one of the good opportunity, I guess that UNICEF in particular and ILO, they are speaking the same language that is requested by the disability movement, and given that both UN agencies are the lead agencies in this arena. Also part of the opportunities that the COVID-19, despite it has been hard for the disability movement, but it was eye-openers for them also to talk about social protection. And now within the movement, there is a lot of discussion about social protection, reframing the social protection in a human rights-based approach, because traditionally persons with disabilities has some uneasy relation with the social protection because they would like to move from the charity approach to the human rights-based approach, and that creates some confusion within the movement. But after the COVID-19, and now this confusion started to be clear in line with the human rights-based approach. In the International Disability Alliance, also we do a lot of capacity building trainings within the movement to have unified voice among persons with disabilities in order to be able to engage with the social protection debate and discussion. This will lead me to the next point, that we need to engage persons with disabilities whenever we discuss about social protection and persons with disabilities, so they will be able to contribute to such discussion. And finally, we talked a lot about non-medical approach for assessment, but there is a real need to develop tools to help government on how to do that, because it's not easy just to say that we need to move from the medical assessment, and we don't know exactly what are the tools and so on. So thank you.
Thanks, Alradi. So there's a comment in the chat box from Vina about gender differential needs of persons with disability, I guess in regards to experience of stigma and discrimination. Is that something you want to put in for a research and learning, Vina, or can you clarify that? Maybe come in and clarify that.
Hi everyone. Unlike others, I have not worked in this area, but I plan to work. So two issues, I think, invisibilizing disability, especially for women and young girls, is very common in some of the countries, I believe, especially in India, I have seen this. So I felt that none of the colleagues have mentioned this. So if in case they feel that this is something, in my view, it should go to research and learning needs, because we need to know whether needs are differential for women, for men, or for girls and boys, or that group. So definitely that point. And other one, I had 2 points on that. So one is, So stigma and discrimination is also related because we do not see a lot of communication strategy around this, either in terms of entitlement and thing. And I think that this entire discrimination on the ground of disability is also very, very prominent. So what is the experience of colleagues, and do they think that this stigma discrimination is making family not to be very forthcoming to educate their children and girls and women to report? So maybe the numbers and data that is given by the government usually may not be presenting the accurate picture of real disability, where people may not be participating or may not be exhibiting very forthcoming in terms of talking about the disability related challenges and issues, be it mental illness or be it physical disability, locomotor, etc. So just a thought, I really have no idea about this. Thank you.
Thanks, Veena. I think we have about 10 minutes left for the breakout room. And so we've been asked to prioritize our top two from each of the three columns. I guess USAID will have access to all of the notes and things like that to refer back. So they'll have access to all the conversation. But when we go back to plenary, we have to present just two. So maybe we'll start with advocacy. There's 5. It's very small now. So the advocacy opportunities we were talking about were the need to advocate for persons with disabilities to have access to benefits, not just the disability pension, but also disability extra costs, and also ensuring that that is compatible with work. So making sure that the advocacy opportunity could be like a holistic approach to ensuring that persons with disabilities have basic income security, either from the disability pension or from work, and then also to have the disability costs provided on top of that to ensure full participation in society. So that, I think, was one of the advocacy points. The second, excuse me, the second advocacy point was around the need to move from the functional assessment, the need to move to the functional assessment from the medical assessment, making sure that there is a full understanding of support needs, to provide holistic support to persons with disabilities. So that was the second advocacy point. The other advocacy point was, well, maybe it was just more of a link. You know, a lot of the advocacy needs to be driven by evidence. So making sure that we are, any of the advocacy that we're drawing on has a good evidence base. And let me see. Susan, did you had your hand up?
Yes, Lisa. I think point number 5 linked so well with point number 3. I think it's already who had mentioned it. It's okay. Around accessibility and inclusion, and I would say that it could be one of the priorities, and then also on the functional assessment as well would be another priority.
Okay, so we have a vote for accessibility and inclusion and functional assessment as a 2. Does anybody else want to give in their opinion?
So I just thought that it's better to say that this functional disability component should be integrated with medical disability, because it's not either or. Medical disability assessment is very, very critical for many assistive devices and other purposes. So it cannot be either or situation, and I don't think we should recommend either or, but it should be with functional assessment combined with medical assessment.
Okay. Alrighty.
If I can add here,
correct me if I'm wrong, but the functional assessment does have a medical component in it as well, doesn't it?
No,
No.
When we talk about the here assessment for obtaining the disability status, and then you will be eligible to access the social protection scheme and so on. However, when we go for assisted devices, indeed, we need to have medical assessment, not to identify persons with disabilities, rather to identify what is the suitable assisted devices for them.
Okay.
I hope I'm clear.
Yes.
Yeah. Yeah. So and here for me it is so difficult to have a priority, but I would like to have a cross-cutting issue that consultation and involvement of persons with disabilities organization throughout.
Okay. Maybe I could put that in capacity strengthening. Maybe it goes better in there to strengthen the capacity of the system to be more participatory and to engage more with stakeholders, a wider range of stakeholders, DPOs.
It could be.
That could, maybe I could put that over there. Okay, so maybe. All right. Does anybody else want to come in either on advocacy opportunities, or we can move to any of the three? Capacity strengthening in terms of the need to build capacity also of carers and service providers to work with persons with disabilities in a more dignified manner, ensuring that there are robust tools to do the different assessments. Does anybody want to come in on that?
Yeah, just if we can add like capacity building for different stakeholder engaged in social protection, and like because in many cases the issue is about the policy making itself, so the policymaker could be part of this.
Okay. All right, and we only have three kind of research and learning needs, so maybe that's a little easier to prioritize. So one is on community, first one was on community services, kind of the need to understand, I guess, the impact of the community services on persons with disabilities and their availability, and how we can, support that a little bit more and link it more with cash. The second was on the understanding the different needs of persons with disabilities based on their different identities, gender, age, things like that. That could be services and cost of disabilities. So having a better understanding of those specific needs. And then more issues around stigma and discrimination on how to combat that. And then more investment in generating data. I guess this could either be through administrative systems, which could link with capacity strengthening, but also on routine surveys, censuses, and things of that component. So, which I guess now that I read them, there's four research and learning needs. So does anybody want to give a vote on which ones we should be prioritizing?
I think first two are good.
Okay.
You mentioned fourth one. What was it?
The fourth one is the second part of the third one. So the number 3 combines 3 and 4. So the third one was on the needs to address stigma and discrimination, understanding what stigma and discrimination practices are creating barriers for persons with disabilities, how to address them. And then underneath that, there's numbers and data of government to reflect disability, which is really the number 4.
So second, third, and fourth are almost can be combined together because all relate with the data and evidence.
Yeah. All right, so then we will, so I'll just recap maybe. So the advocacy opportunities, we're talking about moving, ensuring just a general advocacy message of ensuring accessibility and inclusion. So ensuring the extra costs with disabilities are covered, the compatibility with work is covered, as well as the disability pension, and then ensuring that systems overall or programs are accessible overall, and understanding those barriers. And then the second was on moving away from the medical model to a model that assesses more of the needs of a person's, the holistic needs of a person with disability. So not just giving a kind of a medical certification, but understanding the service needs and the assisted devices needs as well. So, right, those were the two for advocacy. On capacity strengthening, where are we going to now?
I'm sorry, Lippy, I'm coming on same point again and again, because the medical assessment is very critical for even assistive device. And the kind
that's
of
what Dina, that's what I said. I didn't say it was just the functional. I said it was moving to one that considers the holistic needs. So, both the needs, it could be the medical model included in the understanding needs for the assisted devices, the services, things like that. So it's just moving from a medical to a more holistic understanding of the needs of persons with disabilities.
I don't think we should say moving away, because we are not moving away. We are saying combine medical assessment with functional as a part of it, so that you have more holistic view in terms of different level of inputs and intervention, including in terms of assistive device, the services that will vary. Somebody is completely blind, someone has difficulty in seeing, somebody is totally cannot move. So there are varying degree of disability, and henceforth medical assessment is very, very clear. And then it is also linked to functional ability of the person, which can vary with types of disability, and it can vary person to disability to disability. Henceforth, both have to be integrated and in a very holistic way. So that is what my point was. I totally agree with the group and you, but I'm just thinking, should we say moving away, or should we say medical assessment combined with functional assessment of disability should help having design integrated package of benefits and services.
Alrighty, you want to come back in?
Yes. Yes, I would like also to insist on this, because this is one of the recommendations of the CRPD committee, always to move from medical approach on assessment to functional and need-based approach. And again here, the assessment is only about obtaining the disability status. It is not about providing assisted devices and so on. For the assisted devices, indeed, you need to check, for example, how like the limbs work and so on, and this should be related to the medical and so on. But to obtain the disability status itself, the medical approach always not been recommended by the CRPD committee, and I guess we need to be in line at least with the authoritative body who usually provide clarification on the right of persons with disabilities, and in particular here in the right to social protection.
Okay, Yuta, you want to come in?
Yes, thank you so much. I think the second part, as I said, not only accessibility and inclusion, but sorry, I mentioned always the compatibility. I think you can just parallelly ensure accessibility, compatibility, and then inclusion or something. So that the compatibility is work, and then the other scheme can be also achieved, I think.
Okay, I'm just to write something down, a note to myself. All right, so Logan, for the capacity strengthening needs, they said we have a couple more minutes. They're going to close at 9:30 instead. So for the capacity strengthening needs, we had decided on which were our top two. Did we note that?
Sorry, I don't remember voting on that one.
I can remind you. We talk about building, about the different stakeholders, including policymaker, care services, and so on. And we talk about the engagement of persons with disabilities in order to have a participatory system approach.
Yes. Okay.
Did we have a second one, or was that two?
So that was two. So it was the one on including stakeholders, particularly persons with disabilities and DPOs in policy making. So strengthening the system so it's more participatory. Sorry, more participatory, and we're capturing the voices and perceptions and preferences of persons with disabilities within the policy making, and then also on strengthening the capacity of the. Alrighty, can you repeat the first point again? I think I also got a little bit.
There is one on strengthening the capacity of stakeholder engaged in developing and like implementing the system, including service providers, policymakers, and so on.
So Logan, it's strengthening the capacity of the service providers, caregivers, all stakeholders to, I guess, understand disability, inclusive social protection better, like raise awareness about the principles and how to work with persons with disabilities in a dignified manner. All right, and then research and learning, sorry. It was the first point on the community services, to understand the impact of services on persons with disability, their availability and things like that. And the second point was understanding the needs, a better understanding of needs of persons with disabilities. So the different needs of persons with disabilities. Oh, we're going out. So thank you, everybody. We have 3 seconds left, and we're going to merge back into the bigger room.
With that, let me pass it to group 3. Ruth, if you could share your top priorities in the area of advocacy.
Well, sure. Yeah, we had a really interesting in-depth discussion and lots of different ideas. So hopefully they'll all be considered. But for our top 2, we wanted to highlight, first and foremost, advocacy around the importance of women's empowerment and young people's empowerment being central to social protection work, especially in conflict situations and emergencies, because we feel like that's a very significant gap, and that's sort of a weakness of international and national systems to sort of bring together in emergency contexts. And then secondly, we talked a lot about the sort of challenge of prevailing myths with social protection, the idea of them being handouts or, increasing dependency or, various negative and proven to be myths, and putting forward a very strong positive counter narrative around human capital development, the triple or quadruple dividend of investing in women and young people in terms of sort of for children now, for the next generation of children, for women now, and also for economies. So yeah, a big advocacy push around tackling those myths and a positive counter narrative from us. Over.
Thank you very much, Ruth. Louisa, could you summarize the priorities of your group, or breakout group number 4? And again, this was focused on people living with disabilities.
Yes, so like everybody else, we had a very in-depth discussion, lots of advocacy points coming out. And so the top 2 that we felt were the best were the first on moving towards a more integrated model of a disability assessment, Right now, most countries focus on solely on a medical model to provide the disability certification, which is then used a lot in times for determining eligibility, but there needs to be a move to include a functional component as well to really understand the needs, the diverse needs of persons with disabilities, and the wraparound services that they require as well. So that was the first area. And then the second area is just a greater advocacy to ensure that social protection services are accessible for persons with disabilities. They, continue to create different barriers to accessing the services and benefits. The compatibility is also something else that needs to come in more strongly in terms of ensuring that persons with disabilities are able to access income support programs, so like a disability pension, or access to employment, but also at the same time, a benefit that covers disability-related costs. And this is a more transformative approach to social protection for persons with disabilities because it allows them to participate in society on an equal basis as persons without disabilities, because it will compensate for those extra costs that they experience, but at the same time can either work and be income secure or receive benefits and be income secure. So that's all from our group.
It's quite a lot. Thank you very much, Luisa. Thanks for summarizing that. So we're going to cycle back through now and look at our second area of inquiry. What are the key priorities for each of these subpopulations in terms of capacity strengthening? Christina?
Yeah, thanks a lot. And as you can see from these notes, we had a very, very complex discussion, and I would really like to acknowledge the really kind of super excellent work of our note taker Laura in capturing that. I think our first point is really a double point, which is on the one hand on the question of looking at the financing kind of capacities. And I mean, we interpreted capacity strengthening in a very broad way. So really also looking at strengthening the institutional capacities. And I think there we're focusing on both the contributory schemes and most importantly on social insurance, but also looking at non-contributory schemes and programs which are financed by general taxation or by other means. So really trying to strengthen those mechanisms, make sure that they're kind of sustainable but at the same time also that they're equitable and easy to reach. And the second point, or the second part of that point, which is quite closely linked to that, is building the capacity of representative associations within the informal economy, so that they really can have a voice and that they can participate in those processes, and not only with respect to the initial policy formulation, but also in a way of kind of giving feedback loops and giving feedback why some things might not be working for them, so that really to help policies to improve in the longer run. And our second point is really more about the way how the administration works in a very broad sense, ensuring kind of that the system works as a kind of a coherent whole and not a kind of just a collection of fragmented kind of sub systems. So ensuring interoperability, ensuring that people who are on the move, I mean, both kind of within countries, but also across countries, are really able to make sure that their kind of benefits and entitlements are portable. And I think to a large extent also leveraging existing infrastructure and existing institutions, and not to build kind of parallel structures. So improving to the extent possible what is already there, and building on that rather than to establish a parallel structure. So that it's really about a kind of building a system as a kind of a coherent whole, which works for everyone, including for informal workers. I'll hand back to you. Thank you.
Okay, thank you very much, Christina. And likewise, we had a very rich discussion about this in our group and more detail than I'll be able to summarize here. But I think in doing so, what we really came down to in terms of capacity strengthening was also partly in general awareness raising in particular of service providers to really understand the distinct kind of barriers to accessing social protection of these different groups and what some opportunities may be. So just helping them understand, again, how needs have changed, particularly in light of COVID, but also climate adaptation, and really looking at some of the areas where operational support can be provided to service providers, particularly at the local level. But before I go to the next group, I want to ask anyone in my group if they could further clarify or add more detail to that, those priorities and capacity strengthening. Okay, if not, rest assured, we'll have much more detail available in the notes that come from this discussion. But in the meantime, I will pass it to you, Ruth, for capacity strengthening priorities for Group 3.
Thanks so much, Tom. And just to echo, I mean, it's so great to see the things that are coming out of other groups, and we had quite a lot of overlap in ideas. We did pick out 2 top priorities, but I think some of the description of kind of operational coordination and kind of sheer numbers of staff came out strongly for us as well. But the top 2 were, number 1, around inclusive data systems and having the capacity to also handle data sensitively and ensure that sort of you're compliant with basic protection around personal information, survivors of violence, disability status, etc. And then also specifically capacity for genuine, meaningful, inclusive social dialogue with a whole range of different groups. But obviously our group was focused on young people and women, to ensure that both the design and the implementation of our social protection programs or systems are genuinely inclusive and responsive to those needs. And I think that point about feedback loops that came from the informal economy group is also really critical. So, you know, the kind of complaints procedures, grievance and redressal mechanisms that we have, that they're genuinely inclusive too. And I think the linking with the private sector is an error. That's a stray post-it note. Thanks.
Thank you, Ruth. Louisa?
Sure. So similar to the other groups, our 2 priorities in capacity strengthening are first, strengthening the capacity of the service providers, caregivers in particular also, and other stakeholders around understanding disability from a rights-based perspective, and understanding the diversity of disability and changing the mindset from disability and how to engage with them in a more dignified manner. So ensuring that across the board, the service providers, caregivers, and all stakeholders have a more human rights-based approach to dealing with persons with disabilities, and also understanding disability, which can translate to better policymaking. And then on the second point, similar to the gender group, strengthening the system to be more participatory, to ensure that persons with disabilities, organizations for persons with disabilities have room at the table, have influence over the design and implementation of social protection schemes and the like. So that's it from our side.
Excellent. Thank you very much. Mindful of time, I think we're doing okay, and we're going to cycle back through our last kind of area of prioritization, which are the priorities for research and learning. So again, Christina, if you could summarize your group's input on the priorities for research and learning.
Thanks a lot, Tom. I mean, if you could just see our list, we have a very, very long list of priorities. But let me just kind of focus on the two which are on the screen now, and I'd like to start actually with the second one, about kind of the economic savings, and I would kind of maybe expand that a bit about what is really the value of social protection and increasing resilience, both for individuals, but then also at the kind of at the macro level, and also looking, for example, at what is the value, for example, for enterprises. And I think this is another important point that is sometimes overlooked. So it's really, and I think we already have quite a lot of evidence of what the value of social protection is, to have also kind of better arguments for policymakers. And this is where it links to the first point, really. I mean, strengthening the evidence that we have and better communicating them also to policymakers. And we discussed specifically about ministries of finance, but we also discussed about international financial institutions, which are also a key player in that. And I think this is really about really the case for universal social protection and the case for investments in social protection, really to strengthen resilience, to help social and economic development. And also, and if I may just add that point, which came very strongly also in our discussion, to really have strong messages also about what works and what is limited. And one example that came into our discussions that came in very strongly was the fact that kind of voluntary approaches, which are more or less savings mechanisms for informal workers, they have a very limited reach and effectiveness. And I mean, we all know it, but we also see it kind of spreading out. And so I think it's also a bit the understanding of which approaches kind of have a kind of a more kind of a limited potential, and also seeing about where we can actually, or where those investments really can have the greatest impact. So thanks a lot for that. And again, many thanks to all the members of the group, and especially to Laura, who put it all together. So thank you so much.
Agreed. Thank you very much to all of our note takers for capturing all of this detail. And thank you, Christina, for summarizing that. In terms of our group, again, people on the move, some of the research and learning priorities, as I mentioned before, just to enable greater understanding of the distinctions between, say, IDPs, migrants, returnees, refugees, understanding that their challenges, their needs in terms of social protection. There are some commonalities, but certainly some key differences. So we want to advocate for more research and learning to better understand that. And in particular, I think what we'd like to do is promote research and learning that demonstrates the real benefit, the value of extending social protection to these groups in terms of improved well-being outcomes. I think another key point that was discussed was we'd like to have research and learning to help us better understand experience through different stages of displacement and reintegration, understanding that needs do evolve and change. And similarly, we'd like to have research and learning, and I'll try to explain this as best I can, but to help kind of contextualize the needs of displaced populations in light of those with host communities who also have their own needs in terms of social protection. How best can those be designed in a complementary and effective way? So certainly there are more research and learning priorities that we discussed. Those will be in our notes, but let me pass it next to you, Ruth.
Thank you so much. I think in terms of our group, again, we had a long list of key gaps. I think in terms of the evidence around our first post-it note, it's really, I think maybe it's helpful to think of it as priority client, maybe, in terms of low income country governments. And so we really talked a lot about both in terms of different models for effective financing, and maybe it's about passing what we already know, or more investment in evidence around why it's an investment economically, as well as for some of the, we have so much evidence around some of the human capital development areas. So yeah, that's kind of an umbrella of evidence and support for low-income country governments, so they can, you know, see the case for investing in social protection, and then maybe slightly more kind of operational learning rather than research. The need for more case studies that showcase effective models that support youth empowerment and women's empowerment and tackle gender inequality. And if I can be slightly sneaky and weave in a third in relation to that, studies on sort of effectively scaling up pilots, because I think there are lots of great pilots out there with sort of gender specific components or youth specific components, but seeing that embedded in social protection systems at scale, particularly in low and middle income countries, is a gap. So kind of really making the case for that, both in terms of the learning and the research, but actually just doing it, supporting that scale up, because without it, we don't have the evidence or the case studies. Over from us, thanks.
Thank you very much, Ruth. Luisa?
So one of the big research gaps we identified was around community services. So while I think a good amount is known in general about the impact of cash, one of the big black boxes is on community services and how they can impact, along with cash, the empowerment and inclusion of persons with disabilities. So I guess more of like kind of like a cash plus model, but with a focus on community services and how they can be more effective and available, and how we can scale that up, because generally community services are very sparse in a lot of countries. The second the research and learning priority is to understand the different needs of persons with disabilities. So persons with disabilities are not a monolithic group. They are very diverse in terms of their functional impairments. And then on top of that, the other identities that come with that, gender and age, ethnicity, and the like. So understanding what are the specific needs for the different groups of persons with disabilities in terms of cash and services, and in terms of the barriers that they face, like stigma and discrimination, and how they manifest in a low uptake of services. So those were our two.
Okay. Thank you very much, Luisa. And noting time, I want to thank everybody for your very, very valuable input. We've certainly learned a lot. We hope you have as well. Rest assured, we will be compiling, condensing all of the very rich conversation and the notes from them. Thanks again to our note takers. But we will share out a brief summary document from this consultation with everyone who contributed to it. So thank you very much. With that, let me pass it back to Lara Evans to close us out.
Perfect. Thank you so much. And, you know, every time we have one of these and we sort of rush through this prioritization process, I'm like, strangled conversation. But we do it because we want to have something at the end that we can share back. So, you know, for our purposes with the real contract, thinking about, you know, what can we do with this? And so I was just kind of scribbling some notes around, first of all, I think there's some really key patterns and key trends that came up across each of the groups. And it's nice to see that. So to think about, you know, a piece of work that might address some of the priorities that we address for multiple groups, but you know, real, which is our contract, can develop sort of these design guides that maybe you have for your field staff of how to, you know, key considerations for inclusive social protection, or a cheat sheet for a conversation with the Ministry of Finance. a case study of how to expand this. So, we try and synthesize it down, even though it feels like it cuts the conversation short, because we want to be able to do something with what it is that we're discussing. And we want to be able to share back to each of you and your organizations to say, oh, maybe, maybe ILO can do this piece of evidence, or maybe UNICEF wants to follow up on this learning. And so that's kind of the point of trying to have these prioritized conversations. And I think we're going to close in 2 minutes, but Emily's going to put in the chat, if you have additional thoughts that you want to share, there's, there you go, an email address that you can share those to, and also a link to a SurveyMonkey just to say how you think this went. And lastly, just to put your name in the chat, or email this email address of real@savethechildren.org to say if you would like to participate in our last consultation, which again will be around social protection and social cohesion and social protection in fragile and conflict environments. So the point of each of these is to try and have a deep dive with people in the field, on the ground, boots on the ground, operationally, real challenges, that they need tools and resources to sort of overcome those challenges for the greater goal of having social protection be more inclusive, and recognizing that there are 4 billion people that have no form of social protection. So we know there's a long way to go. So thank you so much to all of you for participating today. We look forward to your feedback and continued engagement, and we'll see you at the next one if you want to join us. So thank you.